Hello and very good evening, friends. I hope I am audible to everyone. So, good evening, everyone. Am I audible? I'll just wait for everyone to come over. Okay, so I think yes, I am audible. Let us start the today's session. See, beta, today it's a very fast forward session. I will probably be very quickly cruising over what are the most important high yield points. That is our first focus, because your exam is just in few hours, I can say, or in very few days. This exam is primarily for all the FMG aspirants. It is primarily, we are going to focus only for the foreign medical graduate exam. So this session is highly oriented about the most probable questions that you might encounter for your exam. We are going to talk about the high yield topics. That is point number one. Second point is about the doubts. Any doubts you have, you are most welcome to shoot it in the chat box. I will be answering as and when during this session. This session will be approximately, you can say, around 1.5 hours, 2 hours max of that. And I will try to cover most important high yield topics that you should be knowing for your exam. Next is about the controversies. So absolutely talking about controversies, it's not very like crucial for your exam, but because you have so many doubts, and therefore we try to address all these doubts, controversies. Let us take the first topic, that is the controversies only. So I was waiting for all the students to join in, because we are going to discuss the controversies. These are the 5 most common controversies that I get. So first is, what is perinatal mortality? First doubt that is the confusion is, what is perinatal mortality? See, these doubts that you have, these are valid doubts. They are not that these controversies, these are valid controversies. It is not that probably you only have these controversies. It is just that everybody has these controversies. So if you get a question on the perinatal mortality, please note that the perinatal mortality is taken by the WHO definition, for perinatal period. What is the perinatal period? If you get a question on what is perinatal period by the WHO, I'll just move around this logo a little bit. So, what do you mean by the WHO definition for the perinatal period? It is taken as 22 weeks onwards. 22 weeks onwards is the perinatal period by WHO. Also, please note that as per the National Health Mission, what do we mean by the perinatal mortality? What do you mean by the perinatal mortality? Perinatal mortality is taken from 28 weeks onward. So I know this is a valid controversy. It is not that this is right or WHO is right, Government of India is wrong, or India is right. They are wrong. It is just that in India, we take the perinatal mortality period from 28 weeks onwards. I can just show you this in case you can read through this. This is from the Park 26th edition, page number 648. If you just look at this, can you look at this? What is perinatal mortality? Perinatal mortality is defined as late fetal deaths, 28 weeks of gestation plus early neonatal deaths. So please remember that what do we mean by the perinatal mortality? It is from 28 weeks. So I know there are two different answers. WHO says from 22 weeks onwards and National Health Mission says from 28 week onwards. So you have to be careful in your exam. If the question says directly WHO perinatal time period, if the question says WHO perinatal time period, you have to mark 22 weeks. If nothing is mentioned, I would suggest you to mark National Health Mission perinatal mortality from 28 weeks. I repeat, if the MCQ says according to WHO, what is the perinatal time period? There is a difference between period and mortality. If the question says WHO time period, you have to mark 22 weeks. If the question says nothing, like nothing is mentioned, I would suggest you to mark 28 weeks. I know somebody might have a different school of thought, but if nothing is given, then you don't know what to do. I suggest you to mark National Health Mission because you're going to give Indian exams. So otherwise, if question specifically says National Health Mission, then you need to mark 28 weeks only. Point number 1, controversy number 1 ended, solved. Any doubt, please ask me. Any doubt, please ask me so that I can move to the next one. Point number 2. What is about the rabies re-exposure? Rabies re-exposure guidelines. If you look at the rabies exposure guidelines, you have a pre-exposure, that is to give 3 doses, 3 visits. Then with the pre-exposure, you also have a post-exposure. Post-exposure, pre-exposure is 3 visits. Yeah, you can ask your doubts. Anybody who wants to ask something, you can just put it in the chat box. Okay. If you talk about the post-exposure guidelines, post-exposure could be Thai regime or the SN regime. Please remember SN regime for rabies. Thai regime or the SN regime. I'll have to move this a little bit down. So if you talk about the post-exposure guidelines, it is Thai regime or we can have the SN regime. Please remember that the Thai regime, this is intradermal, whereas the SN, this is intramuscular. The SN regime is intramuscular regime, Thai is intradermal. Now, in what cases are you going to give the re-exposure guidelines? Please remember that the Government of India, as per the National Rabies Control Program, the re-exposure guidelines, it is said that it should be given to all patients if they have taken pre-exposure or post-exposure prophylaxis, if they have already been immunized 3 months ago. If the time period is more than 3 months ago, if it is more than 3 months ago, then you need to take the re-exposure prophylaxis. More than 3 months ago, you need to take the re-exposure. There was an office order in 2019 which said that pre-exposure you do not need the 3 months exposure, but the government has again clarified that all the cases of pre and the post exposure, they will get a re-exposure only after 3 months of the previous exposure. So please remember, as per the National Rabies Control Program guidelines, pre and post exposure more than 3 months. Yes, there was an office order which was stating that all cases of pre and post exposure more than 3 months, but that has been solved now. Any case who has a documented, it should be a documented pre or a post exposure which has been taken, and it can be we can give the re-exposure again. Okay. So coming to the next controversy. So I have solved 2 controversies for you. What do we mean by the perinatal time period? Second is, what is the rabies re-exposure guidelines? Third is, a lot of controversies you ask me every day about the NLEP drug schedule. NLEP stands for the National Leprosy Eradication Program. Under NLEP, please remember that under NLEP, the first controversy is regarding the diagnosis. So the diagnosis, there are 3 cardinal features. One is there is hypopigmented, less pigmentation, or there could be reddish lesions with sensory deficit. So please note, it is reddish lesions with the sensory deficit, that is what is called as the most cardinal feature. The second is regarding the diagnosis of M. leprae in the lesion. So first is this, second is this. Third cardinal feature is which may be there in possibacillary, which may not be there, but it is one of the cardinal features. If it is present, it is almost diagnostic of leprosy. That is involvement of peripheral nerves. It is not only peripheral nerves. It is involvement of nerves with definite thickening. So with the definite thinking, with involvement of nerves, that is kind of a cardinal feature for leprosy. Other feature we can have is loss of sensation with weakness and paralysis. So these all three are the cardinal features. Please remember that for possibacillary, the diagnostic modality is basic diagnostic modality is to have 5 or less lesions, and there should not be any smear positive. Regarding the nerve involvement, there are still controversies. Some people say nerve involvement is there in possy, it may not be there, like no or one nerve involved. That one line is almost off. But anyways, for your exam, please remember any lesion which is less than 5 or equal to 5 and no AFP smear, that is possibacillary. For multibacillary, it is 6 or more lesions with nerve involvement, any smear positive for acid fast bacilli. Next is what is the treatment. As per beta, the NLEP regime. Please note that the NLEP regime, we are giving 2 drugs for possibacillary and we are giving 3 drugs for multibacillary leprosy under the NLEP. Under the WHO regime, which is the updated WHO regime in 2018, they are saying to give 3 drugs. That is 3 drugs for both possibacillary and for multibacillary both. Possibacillary will get 3 drugs, multibacillary will also get 3 drugs. So that is regarding the NLEP controversy. Please remember that in India we are already using the green blisters and the blue blisters. The green blister and the blue blister, the green is for adult possibacillary, the blue is for child possibacillary. Whereas we can also have the red color blister or we can have a brown color blister. The red color blister or the brown color blister, please remember that the brown color blister is for child multibacillary. The red color blister is for adult multibacillary. Okay, so please remember, you can remember I've told this mnemonic many times. B for brown, B for baby or child. So brown is for child, B for blue, and B is for child again. So remember, B for brown, B for baby, B for blue. You can remember the child has kind of B's. So I have a doubt over here. PEP in rabies is single site or bilateral? If single, what dose? The PEP, beta, what do you mean by PEP? PEP stands for the post-exposure prophylaxis. PEP, it stands for the post-exposure prophylaxis, bache. So post-exposure prophylaxis, I told you it can be thigh regime or we can have the SN regime. The SN is intramuscular, thigh is intradermal. In thigh, we give 2 sites. Whereas in SN, we give only single site. So, PEP in rabies is single site or 2 site, that is your answer. And in case it is a re-exposure prophylaxis, it is only 1 site. We give intradermal or we can give intramuscular. It is only single site injection in re-exposure prophylaxis. Okay, so please make sure that you know about rabies in and out. Please make sure that you know about NLEP in and out. It is very important for your FMG January 2023 exams. Another point which is important and very frequently asked in your exam is regarding the NLEP indicators. So another very frequently asked topic is the NLEP indicators. I have already put a sequence of the MMFCs. What does MMFC stand for? MMFC. Beta, it is Mukhmohit's flashcards. I have generated a series of flashcards, and these flashcards are the most important frequently asked questions in your exam. These series of flashcards are already available on my Instagram channel. So if you just search for my name Dr.Mukhmohit, you will find it on Instagram. These are series of flashcards which are already available. So this is also one of the, I've taken directly from my flashcard number 1093 for the leprosy indicators. It is a very frequently asked question. Which are the essential indicators for your FMG exam? You have to focus on this only. You have to focus only on these 4 indicators. I bet on this you are going to get a question from leprosy, rabies, very frequently asked. Okay. So what are the essential indicators? Say with me. The essential indicators are ANCDR, annual new case detection rate. It is taken as per lakh population. Then we also have the prevalence rate, which is taken as per 10,000 population. Prevalence rate of leprosy per 10,000 population. Next is the treatment completion rate, that is proxy to the cure rate. We can also have the grade 2 disabilities, number of grade 2 disabilities per 10 lakh population or per million population per year. So these are the 4 essential indicators. Which are the 4 essential indicators? ANCDR, prevalence rate, then we have the treatment completion rate, that is the TCR, and fourth is the grade 2 disability rate. These are the important essential indicators. बाकी आपको you don't actually need के हमें सारे indicators याद करने हैं. Yes, for your exam, FMG exam, you are supposed to focus on these 4 essential indicators. So बेटा ये 3-4 कंट्रोवर्सीज हैं. यस, इसके बाद मैं आपसे ज़रूर क्वेश्चन आंसर डिस्कशन भी करूँगा. आई गॉट वन पर्सनल मैसेज, डायरेक्ट मैसेज राइट नाउ कि क्वेश्चन आंसर प्रॉबेबल क्वेश्चंस डिस्कस करने हैं. आई विल बी डिस्कसिंग दैट ऑल्सो. Next controversies very frequently get is upon the biomedical waste, vacuum gloves, syringe wrappers. ये सब चीज़ें कहाँ कहाँ जाती हैं. Please remember that in the biomedical waste category, any type which is we can have these 4 colors, right? Yellow, red, blue and white. Very frequently students confuse होते हैं. Please remember gloves कहाँ जाते हैं. Gloves चाहे वो blood stained है, without blood stain, they all go to the red category. Then you have all the dressing material, cotton, gauze, cotton, all these go to the yellow category. Again students बहुत confuse होते हैं. Please remember that the blood products, blood bags, blood transfusion sets, they all go to the yellow category. Please remember, उल्टा नहीं करना. urine bag, IV sets, they all go to the red category. अच्छा, blue में क्या जाएगा? blue में जाएगा glass plus very important orthometal implants. Orthometal implants, they go to the blue category. White में क्या जाता है? White is for sharps, right? So please remember, ये बहुत ज़्यादा controversies आती हैं, doubts आते हैं. Yellow में we also have the intrauterine devices जो used IUDs हैं. They also are taken as soiled material. Then yellow में you also have the cytotoxic drugs. Yellow में you can also discard the vaccine. Unopened वैक्सीन वायल्स, जो लाइव वैक्सीन्स होती हैं, ये भी येलो कैटेगरी में जाती हैं. दे ऑल आर इन द येलो एच कैटेगरी विच इज़ द हैजार्डस वेस्ट. येलो एच कैटेगरी विच इज़ द हैजार्डस वेस्ट. सो बायोमेडिकल के ऊपर भी देर आर लॉट ऑफ कॉन्ट्रोवर्सीज एंड लॉट ऑफ क्वेश्चंस. सो वैक्यूटेनर्स किस में जाते हैं? व्हाट डू यू थिंक? वैक्यूटेनर बेटा, वैक्यूटेनर के ऊपर क्वेश्चन आता है. इफ द वैक्यूटेनर इज गिवन, ओनली वैक्यूटेनर आपसे पूछ लेते हैं, वेयर डू यू डिस्कार्ड देम? Vacutainer you're going to discard in the red category. But if they say that the vacutainer with blood, if the question says vacutainer with blood, now you are going to discard in the yellow category. You are going to answer the yellow category. Gloves हमने अभी बात किया, in which category they go? They always go in the red category. Syringe का जो wrapper होता है, जो sheet है उसका, जो covering है syringe का, that is general waste. It goes to the black category or the general waste. It goes to the black category or the general waste. Next एक आता है ASHA population norms. So many I have searched almost many documents को मैंने search करा. Sharp products बेटा, Krish, it goes to the white category. Just now we talked. I'm coming to the next and the fifth controversy, which is again very important for your exam, about the ASHA population norms. Beta, I have tried to search almost every document. I asked many people in the government of India. I can also show you one of the document, which is the ASHA program update. ASHA program update, which was like released in year 2021 till 2022. So this ASHA program update also, it says that the current number of ASHAs that we have in India is 979 ASHAs per population. Like 979 is the current rate. So current rate is 1 ASHA per 1000 population. That is the norm that we have. We want to achieve more than that. We always want to achieve more than that. It could be 1.5 ashas, because you're talking on a population level. It's not always 1 asha or 2 asha. So yes, we want to focus about, we want to bring this from 1000 to 500, like 1 asha for every 500 population. Or in other words, you can say we want to go to 2 ashas per 1000, or we can also go to 3 ashas per 1000. But that is not the focus right now. The focus is that we have already achieved 1 asha per 1000. Yes, we want to achieve it more. But is it there in all the states? Answer is no. In states like Bihar, in many states, it is 1200. Like we have not yet achieved 1 per 1000 asha norm also. In many states, in small states, we can even have 200, 153 in some UTs. Like UT of Lakshadweep, it says that 1 asha for 153. Like you have 10 ashas per 1000, 9 ashas, or you can, do you understand? Do you understand what I'm saying? So in Lakshadweep, it is 1 asha for 153 population. Whereas in Bihar, it is 1 asha for 1241 population. Bihar, it is, I'll write it on, I think it went behind me, 1 asha for 1241 population. So in Lakshadweep, it is still 153 population. In Bihar, 1241. You can't say it is 2 asha or 1 asha. Anyways, for your exam, I would say. Anyways, just to close off the controversy, there is no document which directly says that the norm of Government of India has changed. It has been, like I would say, mistakenly pointed out by some of the faculties. Please remember that the ASHA norms is, I could not actually find a source for this. So ASHA population norms currently, it is 1 asha per 1000 population. Some states have achieved this. For the states which have already achieved this, yes, they are going towards the recruitment of more ashas. Common sense. But it does not say, it does not mean that the norm is changed like it is 2 asha per 1000. Nah, that is wrong. Yes, if you have achieved 1000, you bring in more ashas. That does not mean your norm is changed. So, for example, I'm just trying to tell you, if Lakshadweep has achieved 1 asha for 153, that is 10 asha per 1000. So do you think we will try to fire the ashas, remaining ashas? No, that's not the case. Norm is not about the 2 ashas. Norm is about 1 per 1000. But yes, we want to achieve more. In states which have not yet achieved, they should achieve at least the 1 per 1000 asha. Of course, the next line would be 2 per asha. Right? So, Asha, how much amount is paid according to the Janani Suraksha Yojana? According to GSY, beta, I will give you a flashcard after this lecture is over. I will give you a single flashcard. The Ashas, they receive money in different levels. If it is a low performing state, beta, it is 400 rupees. If it is a high performing state, it is more. It is up till 600 to 700. Now, above that, the state, the government of India is like the central ministry. Then you have the state ministries, the health ministry of the state health ministry. They might give some additional features like 50 rupees more, or 100 or 200 rupees more, or they might club it with other incentives. But generally speaking, under the JSY, because your question was very nice and specific, under the JSY, how much is the incentive given? Under Janani Suraksha Yojana, the incentive which is given is 400 in low performing states and 600-700 in high performing states. Okay. Am I audible? I think there was this thing. So, anyways, these were the 5 major controversies which I wanted to share with you. Any other doubt if you have, you are most welcome to ask. So there are just a couple of updates for you. Nothing much. Don't bang your head on these updates. It's very easy going. So don't focus on these updates a lot. But yes, you should just know very quickly. Fast forward, I'm going to tell you what are the salient features you need to remember. Beta, there was a global genomic surveillance strategy. Global genomic surveillance strategy is to actually have uh, more inclusion of more genomes for surveillance of all the genetic diseases and other diseases which may have some genetic causality. So improve access to tools, strengthen the workforce, data sharing, maximize connectivity. It's kind of more information technology. It is kind of more information technology for genetic disease, that is global genomic surveillance strategy. Next is a few important updates I would say is upon, let's just take a bigger view of this. This is important. Okay. So these are important updates that you have, updates. And again, these could be your prospective questions. The PCV vaccine has been scaled up to pan-India. Now the PCV, that is the pneumococcal conjugate vaccine. Pneumococcal conjugate vaccine is now included as a part of national immunization schedule. It is part of the national immunization schedule. Next is, what is the triple drug regime for the lymphatic filariasis prevention? The triple drug regime for lymphatic filariasis prevention, that is DEC plus albendazole plus ivermectin. This has now been started in all the states. We are now giving 3 drugs for lymphatic filariasis prevention. It is not only DEC plus albendazole. We have also included a new drug, that is ivermectin. Ahan Pandey, yes, you are most welcome to join in this session, but primarily, I'm repeating it again, this session is primarily for all the FMG aspirants who are going to give their exam next week. Next is point number 3. The update is there is a third dose which has been added for the fractional injectable inactivated polio vaccine. The third dose which has been added is to be given at 9 months of age. So the fractional inactivated polio vaccine, the FIPV vaccine, is now given at 6 weeks. It is also given at 14 weeks. It is also given at 9 months of age. The 6 and 14 weeks is intradermal vaccine. It is given in the left upper arm. The dose is 0.1 ml. It is intradermal. In the left upper arm, dose is 0.1 ml. Whereas, not the left, the right upper arm. I'll repeat again. This is 6 and 14 weeks intradermal in the right upper arm. The 9 months is intradermal given in the left upper arm. Please note it is given in the left upper arm and it is 0.1 ml again at 9 months of age. This is the updated fractional immunization schedule which was started since the 1st of January 2023. So make sure you get this also right. And currently we are giving a bivalent polio vaccine. It remains the same. Bivalent polio vaccine we are giving is P1 and P3 strain. The P2 strain is not given. Then you already have the global genomic surveillance strategy. We have already discussed this. A few points about tuberculosis. Please remember that under the tuberculosis, what is the current epidemiology level of tuberculosis? Please remember that for TB, the current rate of TB incidence is 188 per lakh population. The tuberculosis, I'm giving you the NTEP updates, NTEP 2022. NTEP 2022 updates, tuberculosis is 188 per lakh population. The MDR is 4 per lakh population. Bas MDR tak hi yaad karna hai. What do you mean by MDR TB? Beta, MDR TB, I think everybody should know it is H and R resistance. It is both isoniazid with rifampicin resistance. Dono ko mila ke we call it as MDR TB. Then XDR TB, you can just leave it, nothing very special. Very important that the TB diagnostic centers, earlier we used to call them as the DMC. DMC होता था designated microscopy center. Earlier we used to have the designated microscopy center. Now instead of the designated microscopy center we have the TB diagnostic. बस वैसे ही उन्होंने नाम चेंज करना था, वो कर दिया, आपके लिए मुसीबत डालनी थी वो डाल दी. It is TB diagnostic center. So the DMCs have been renamed to the TB diagnostic center. And in the TB diagnostic center 3 types of surveillance करते हैं. One, we do active case finding. Active case finding किस में करते हैं? This is important for your exam. Active case finding is done in high risk population. Active case finding is done in high risk population. Intensified case finding, where do you do intensified case finding? Intensified case finding is where the patient is coming with diabetes and you check them for TB also. So that is comorbidity screening. Patient coming for hepatitis, you check them for TB. And then you have passive case finding where the patient is themselves coming with cough and all that. So no beta, so please remember this is NTEP, National TB Elimination Program. A few updates. There is a doubt over here by Elsa. So what is the PCV new schedule? Beta, I would like to tell you that the pneumococcal conjugate, there is no new schedule. It is the same schedule. मैंने यहाँ पे सिर्फ ये लिखा है कि पैन इंडिया हो गया. अर्लियर इट वाज ओनली लॉन्च्ड इन सम स्टेट्स, नाउ इट इज़ अवेलेबल अक्रॉस इंडिया. इट इज़ अ वेरी एक्सपेंसिव वैक्सीन, सो देयरफॉर इट हैज़ बीन national pride to say, we are proud to say that the government of India, we are providing national immunization schedule with the pneumococcal vaccine in every state in India right now. So these are 4 important updates. इनमें से कोई सवाल आपको आ सकता है. टीबी के ऊपर हमने बात करी. एक और sixth important update. Sixth update. एक हमने बात किया. Fifth update was about TB. Sixth update is about the COVID vaccines. The COVID-19 vaccines, we already were having the viral vector vaccines. Which are the viral vector vaccines, beta? We can have the Covishield vaccine, Sputnik vaccine, Janssen viral vector vaccine और the Incovac. ये सारी viral vector vaccines हैं. Johnson Johnson वाली, Sputnik रशिया वाली, Covishield by the Serum Institute. All these are the viral vectored vaccine. Incovac is the newest vaccine जो कि include हुई है. Incovac is the only nasal vaccine and Government of India, Bharat Biotech, we are very proud to say that the Government of India has produced the only nasal vaccine, that is the BB154 nasal vaccine, that is called as the Incovac. It is a type of a viral vectored vaccine. Next is, what are the examples of killed vaccine? Example is Sinovac और कोरोनावैक, एंड वी हैव द कोवैक्सिन. कोवैक्सिन का जो स्ट्रेन है दैट इज BB152 एंड इंकोवैक का जो स्ट्रेन है दैट इज BB154. सो इंकोवैक इज BB154, कोवैक्सिन इज BB152. Then you also have these protein subunit vaccines, that is Novavax and Corbevax. Corbevax is also a new vaccine which have been developed by India. So Corbevax के ऊपर question आ सकता है, Incovac के ऊपर question आ सकता है. These are important vaccines. So Corbevax, it is a protein subunit vaccine. एक होती है mRNA vaccines which are like used more in the Western world, that is Pfizer and Moderna. Moderna वालों ने अभी there's again a recent update. They also launched a bivalent COVID vaccine. Bivalent COVID vaccine where they had the initial COVID strain. So they had the old COVID strain plus the Omicron strain. So that is a bivalent COVID vaccine by the Moderna company. So now like they are improvising over their vaccines. Okay. So these are some of the important updates. Update number 6 for you was regarding the COVID-19 vaccines. In case you want to take a screenshot of this page, I don't want to waste your time, but there's just a detail over here given for Corbevax and for Incovac. I would be very happy for any student if you can just put taglines over here like minute to minute. Some students have done that for my previous videos. If you can just put the timelines टाइमलाइन स्टैम्प्स के सर ने ये एक चीज़ यहाँ से बताया, ये चीज़ यहाँ से बताया. ऑफ कोर्स यू विल बी लुकिंग थ्रू दिस वीडियो अगेन एंड अगेन. So that will be helpful for you and helpful for your friends and other people also. So Corbevax, Incovac, if you want, you can take a screenshot. इसको बाद में पढ़ लेना. I'm not going to detail. Corbevax, Incovac, ये दोनों 2021 में इंडिया में लॉन्च हुई थी और ये दोनों भारतीय वैक्सीन है. We are proud to say these are Jai Hind and these are proud Indian vaccines. So इनको याद रखेंगे. ये कहीं से नहीं है. एक क्वेश्चन बहुत दफ़ा स्टूडेंट्स ने मुझसे पूछा, व्हाट इज़ अ DNA वैक्सीन. So beta DNA, it's an interesting concept. We also have a ZyCoV-D vaccine. This ZyCoV-D vaccine, it is a DNA vaccine. There's also an important update for you that we also started using the DNA plasmid vector vaccine. But I don't know इसके ऊपर एग्जाम में low yield का है, but you can just note what is a ZyCoV-D vaccine. Okay? प्रखर केशरी जी, आप शायद लेट आए थे. आशा 2/1000 अपडेट हुआ है क्या? मैं कितनी दफ़ा बताऊंगा, आप ये वीडियो के बाद देख लेना प्लीज़. हमने आशा के ऊपर दीज आर द कंट्रोवर्सीज आई हैव ऑलरेडी टॉक्ड एंड दीज आई हैव ऑलरेडी फिनिश्ड दिस टॉपिक. आशा मेरे हिसाब से मैंने बहुत बात किया. इट इज़ 1/1000. गवर्नमेंट ऑफ इंडिया का आशा प्रोग्राम अपडेट आया था, उसमें भी इट इज़ 1/1000. आई डिड नॉट फाइंड एनी सोर्स. अकॉर्डिंग टू मी इट इज़ 1/1000 पॉपुलेशन ओनली. आशा को आप जीने दो, आप भी ज़िंदगी जियो. तो आशा इज़ 1/1000. अभी उतना ही चलो. ओके, सो हमने टीबी की, वी हैव ऑलरेडी टॉक्ड अबाउट द नेशनल टीबी प्रोग्राम. Let us solve a few questions over here. So now it is your question answer session. Now it is your question answer time. Let us have a very quick review about what is your status. So फटाफट से आप अपने आंसर्स लिखने शुरू करिए. आई एम वेटिंग फॉर योर आंसर्स. विच वैक्सीन इज नॉट इंक्लूडेड इन द immunization schedule? What vaccine is not included in the adult immunization schedule? TD vaccine, influenza, meningococcal, pneumococcal. बताओ कौन सा है? Absolutely correct. Very nice answer. Which vaccine is not included in the adult immunization schedule? Which vaccine is not included? It is the meningococcal vaccine. It is the meningococcal vaccine. Absolutely correct. ये बच्चों में, children में दी जाती है. It is given in children. It is not given for adults. It is for children only. Adult immunization, you can take a screenshot of this beta. Please take a screenshot of this. कि adult immunization भारत देश में under the National Health Mission या under the program guidelines हम क्या दे सकते हैं. These are not given free. They are not available free. They are not available free of cost, but yes, they can be given to patients who want it. So please remember that the adult immunization recommended in India, it is the TD vaccine. We are giving a TD boosters 10 yearly, and this TD vaccine is also given to pregnant females. Zoster vaccine, influenza, and the PPV, that is the pneumococcal polysaccharide vaccine. Pneumococcal polysaccharide vaccine given after 65 years. Recently, the CDC and the ACIP, American Council for Immunization, ACIP and the CDC, they both have recommended risk-based indications for adult more than 60 years based on like which vaccines to be given. Plus, they have also included the hepatitis B. Government of India में अभी ये 4 ही vaccines चल रही हैं. Tetanus, diphtheria, toxoid, that is a low diphtheria level. Zoster, influenza and PPV. ये already flashcard number 1041 के नाम से Instagram पे it is available. So make sure you get this right. Question number 2, very frequently it is a 7-star MCQ. It is a 7-star MCQ, Global Hunger Index. It is very important for your exam. Make sure you study this. Global Hunger Index will include what? Global Hunger Index includes which of the following except a question. Life expectancy at birth, wasting rates, stunting rates, undernourishment rates. क्या बोलना चाहते हो? ये इंपॉर्टेंट क्वेश्चन है. इसके ऊपर फटाफट से आंसर लिखो. क्या बोलना चाहते हो? चैट बॉक्स भर दो. What do you want to say? Global Hunger Index includes all of the following except. It is life expectancy at birth, absolutely correct. It is life expectancy at birth, absolutely correct. Global Hunger Index में wasting आता है, undernourishment and stunting rates, all 3 are included. Very nice. I'm so happy for you all. Absolutely correct. It is option number A. एक फ्लैश कार्ड दे रहा हूँ आपको, इसको आप स्क्रीनशॉट ले लो. You can just study this. This is a 7-star MCQ topic. 7-star MCQ topic, very frequently asked in your exam. Please take a screenshot of this. I have discussed over here what is PQLI. I have discussed over here what is HDI, MPI. MPI क्या होता है? MPI stands for the multi dimensional. अच्छा नीचे लिखा हुआ है MPI stands for the multi dimensional poverty index. So please remember ये फ्लैश कार्ड है. This is MMFC. This is flash card for you. Make sure you get it right. It is a 7-star topic. इसका screenshot ले लो, ये आपके एग्जाम में आएगा. So what is global hunger index? It contains under 5 mortality rate, not the life expectancy. It also contains undernutrition, which includes wasting and stunting and inadequate food supply. The current global hunger index for India. It is 29.1. Global hunger index for India is 29.1. This is the latest, and the India is ranking at 107. This is 107 global hunger index. इसमें 3 चीज़ें होती हैं. It includes the child mortality, undernutrition and inadequate food supply. Next is what do you mean by the MPI? MPI beta is multi-dimensional poverty index. MPI is multi-dimensional poverty index. ये screenshot मैंने लिया है directly from the WHO. The source is the WHO, World Health Organization. So what is multi-dimensional poverty index? इसका in case you want you can take a screenshot. Otherwise ये जो आपने ले लिया है, this is done. This is a 7-star MCQ. So it includes 3 levels. Health आ गया, education and standard of living. ह्यूमन डेवलपमेंट इंडेक्स में लॉन्ग एंड हेल्दी लाइफ विद नॉलेज विद डिसेंट स्टैंडर्ड ऑफ लिविंग. एक क्वेश्चन इसमें आता है, आई वुड लाइक टू पॉइंट आउट ओवर हियर दैट व्हाट इज इंक्लूडेड इन द HDI. HDI में is it the GDP? Answer is no, it is not the GDP. I would like to bring to your notice the answer is a gross national income. It is not the GDP, it is gross national income. ये क्वेश्चन बन सकता है. It is a prospective MCQ कि क्या HDI में GDP यूज होता है? No, it is not the GDP. It is the gross national income जो यूज होता है. ये एग्जाम के लिए आपको याद करना है. एक और मैं आपको फ्लैश कार्ड भेज रहा हूँ. ये फ्लैश कार्ड कंटेन्स ऑल द इंपॉर्टेंट इंडिकेटर्स. इस फ्लैश कार्ड को देख के डरना नहीं है. डोंट गेट स्केयर्ड. I have divided the ये जो चैप्टर है पार्क टेक्स्ट बुक में, ये अराउंड 5 to 7 पेजेस का है. मैं यहाँ पे आपको सारे इंडिकेटर्स एक साथ डाल दिए. सो प्लीज़ नोट दैट व्हाट आर हेल्थ केयर डिलीवरी इंडिकेटर्स. ये भी इंपॉर्टेंट, बहुत दफ़ा पूछते हैं. विच ऑफ द फॉलोइंग इज हेल्थ केयर डिलीवरी, विच ऑफ द फॉलोइंग इज सोशियो इकोनॉमिक एंड विच ऑफ द फॉलोइंग आर यूटिलाइजेशन. सो एग्जाम के लिए आपको क्या पढ़ना है? व्हाट आर द डिलीवरी इंडिकेटर्स एंड व्हाट आर द यूटिलाइजेशन. बस यही 2 पढ़ लो. सोशियो इकोनॉमिक आपको वैसे ही समझ आ जाएगा. जहाँ पैसे की बात आएगी ना, वो सोशियो इकोनॉमिक है. इसमें एक क्वेश्चन आता है, मैं यहाँ पे आपको हाईलाइट कर देता हूँ. फैमिली साइज. What is family size beta? Family size is a socio-economic status indicator. It is not a utilization or a delivery indicator. ये क्वेश्चन बन सकता है, इसको आप मार्क कर लो. What are the health indicators? Family size is a socio-economic indicator and not any other indicator. ओके, सो ये अगेन एक इम्पॉर्टेंट आपके लिए स्क्रीनशॉट है. इसको आप ले लीजिए एंड दैट मे बी हेल्पफुल फॉर यू. नेक्स्ट क्वेश्चन इन लाइन, प्लीज ट्राई टू आंसर इट बैक अगेन वेरी क्विकली. लेट्स जस्ट फिनिश इट ऑफ. पैनल डिस्कशन क्या होता है? व्हाट इज पैनल डिस्कशन? सीरीज ऑफ लेक्चर, डिस्कशन अमंग फ्रेंड्स, डिस्कशन अमंग एक्सपर्ट्स, सॉल्व कॉम्प्लेक्स प्रॉब्लम. सो व्हाट इज द बेस्ट आंसर? What is the best answer? Panel discussion is. What do you think? I'm waiting for your answers. Panel discussion is discussion among experts in front of audience. Absolutely correct. Panel discussion is discussion among experts in front of audience. Absolutely correct. इसमें एक moderator होगा. There will be a moderator. There has to be audience. There has to be a group of experts. Group of experts अपने आप में बात करेंगे. Of course, it is not used to solve a problem because they are nobody to decide. So there is no sequence. There is absolutely correct, no sequence. Very nice, thank you so much Madhav Sharma. There is no sequence. Yes, there is no sequence. And group of experts में होता है, ऑडियंस होता है. वेरी नाइस. एक ये वेरी क्विक स्नैपशॉट ले सकते हो, इसका भी स्क्रीनशॉट. दिस इज अ 7-star MCQ फॉर यू. इसका फटाफट से एक स्क्रीनशॉट ले लो. ये मैंने 4 पॉइंट्स डिस्कस किए हैं. व्हाट डू यू मीन बाय सिंपोजिया? सिंपोजिया क्या होता है? सिंपोजिया होता है जहाँ पे हम लेक्चर देते हैं, सीरीज ऑफ लेक्चर टू स्टूडेंट. व्हाट इज अ पैनल? पैनल होता है जहाँ पे ग्रुप ऑफ एक्सपर्ट्स बैठे हैं ऑडियंस के सामने. ग्रुप डिस्कशन क्या होती है? जहाँ पे कुछ कोलीग्स या फ्रेंड्स बैठते हैं, दैट इज कॉल्ड एज ग्रुप डिस्कशन. क्वेश्चन आता है ग्रुप का साइज कितना होता है? 6 से 12 के बीच में ग्रुप का साइज होता है. नेक्स्ट इज ये क्या कर रहे हैं? ये कुछ स्किल शो कर रहे हैं कि CPR कैसे देना है या हमने क्या करना है. तो CPR कैसे देने के लिए दिस इज अ वर्कशॉप. व्हाट इज़ अ वर्कशॉप? जहाँ पे स्किल इम्प्रूव हो, किसी पे लोगों की स्किल यदि इम्प्रूव हो, दैट इज अ वर्कशॉप. ओके, सो इसमें गलती नहीं करनी. कमिंग टू द जनरल हाई यील्ड MCQ डिस्कशंस, वेरी फ्रीक्वेंटली आस्क्ड टॉपिक्स. ये आपके एग्जाम में बहुत दफ़ा, दिस इज अ 7-star MCQ टॉपिक्स फॉर यू. 7-star MCQ टॉपिक्स ये बहुत दफ़ा पूछे जाते हैं. So Amritansh Aluwalia, thank you so much for enjoying the symposia with me. And ये एग्ज़ाम में बहुत दफ़ा पूछे जाएंगे क्वेश्चंस, तो इसके लिए पिक्टोरियल प्रेजेंटेशन थी. A treatment of a female from Odisha with diagnosed Plasmodium falciparum infection and in second trimester. What is this? And the female is in second trimester. क्या बोलना चाहते हो? Treatment of female from Odisha who is with Plasmodium falciparum and in second trimester. Female pregnant है, second trimester में है, क्या देंगे? Treatment of female with diagnosed Plasmodium falciparum infection, what do you think you're going to give? Oral chloroquine, IV artesunate, oral ACT SP, oral ACT AL. 3 दिन के लिए क्या क्या करना है? So please remember, अगर कोई please remember इस पार्टी सर ऑडियंस पार्टी कुंज पांड्या का एक क्वेश्चन सवाल आया मेरे को. ऑडियंस पार्टिसिपेशन इज ओनली इन वर्कशॉप, राइट? ऑडियंस पार्टिसिपेशन इज ओनली इन वर्कशॉप. नहीं, ऐसा नहीं है, बिकॉज इन क्वेश्चन आंसर सेशन, पैनल डिस्कशन में भी दे कैन पार्टिसिपेट, बट येस, एक्टिव पार्टिसिपेशन ओनली इन वर्कशॉप. चलो वापस आओ इस क्वेश्चन पे. ट्रीटमेंट ऑफ ए फीमेल विद फ्रॉम ओडिशा विद डायग्नोज प्लाज्मोडियम फैल्सिपैरम इन्फेक्शन, क्या बोलना चाहते हो? सेकेंड ट्राइमेस्टर में. कुछ ए कह रहे हैं, क्या हो गया तुम लोगों को? समबडी सेइंग डी, समबडी सेइंग ए. भाई मेरी बात सुनो, ये सब लोग अपने अपने आंसर क्यों कर रहे हो? अरे एग्ज़ाम अभी 5 दिन बाद है, ऐसे नहीं करना. ये एक फ्लैश कार्ड है, इसका एग्ज़ाम के लिए, क्वेश्चन के लिए फ्लैश कार्ड है. ये पकड़ो आप एक फ्लैश कार्ड. दिस इज़ MMFC मलेरिया. इसी फ्लैश कार्ड में से आएगा, अगर आएगा तो. मलेरिया का सवाल इसी में से आएगा, PSM से रिलेटेड. माइक्रो की नहीं मैं बात कर रहा. इन केस द क्वेश्चन कम्स फ्रॉम मलेरिया, इट हैज़ टू बी फ्रॉम दिस फ्लैश कार्ड. मलेरिया का डायग्नोज कैसे करते हैं देख लो आप. मलेरिया का ट्रीटमेंट कैसे होता है देख लो आप. मलेरिया का ट्रीटमेंट बेटा, इफ़ इन केस इट इज़ अ नॉर्थ ईस्टर्न स्टेट्स में हम फैल्सिपैरम के लिए ACT-AL देंगे. अदर स्टेट्स में इट इज़ ACT-SP. अब जो उड़ीसा है, उड़ीसा नॉर्थ ईस्टर्न तो नहीं है. सो इन उड़ीसा, इन नॉर्थ ईस्टर्न स्टेट्स we give ACT-AL, but in all other states we are going to give area specific ACT अगर वो फीमेल प्रेग्नेंट है तो. प्लीज रिमेंबर, प्राइमाक्वीन इज कॉन्ट्राइंडिकेटेड. प्राइमाक्वीन नहीं दी जाती. ये फ्लैश कार्ड्स की कलेक्शन अभी वेरी सून, नॉट फॉर योर एग्जाम बट वेरी सून, नीट के जो स्टूडेंट्स एग्जाम देंगे या अभी अगले हफ्ते तक ये रिलीज़ हो जाएगी. ये हमारी एक वन टच फॉर्म PSM बुक आ रही है, दैट इज़ अ PSM रिव्यू बुकलेट. सो दिस फ्लैश, दैट्स अ कलेक्शन ऑफ ऑल द फ्लैश कार्ड्स. सो दैट विल बी वेरी हेल्पफुल फॉर मोस्ट ऑफ द स्टूडेंट्स. एनीवेज, कमिंग बैक टू दिस पॉइंट, ये फ्लैश कार्ड्स है, इसको याद रख लेना. ट्रीटमेंट फेलियर किसको कहते हैं और प्रोफाइल एक्सेस के लिए हम क्या देते हैं. सो दिस इज़ व्हाट इज़ इम्पॉर्टेंट फॉर योर एग्जाम. कमिंग बैक टू दिस स्टोरी, ये प्रेग्नेंट फीमेल है उड़ीसा से, तो इसको हमने क्या देना है, इसको बेटा ACT-SP देंगे ना, देयर इज नो डाउट इन दैट, आंसर इज ACT-SP. प्राइमाक्वीन विल बी कॉन्ट्राइंडिकेटेड, प्राइमाक्वीन इज कॉन्ट्राइंडिकेटेड. कोई शक तो पूछो, कोई डाउट तो पूछो. ओके, लेट अस मूव अहेड. गलती नहीं होनी चाहिए. आई थॉट दिस वाज वेरी इजी MCQ. नेक्स्ट इज लार्वा अटैच टू द रूट ऑफ प्लांट इज फॉर. लार्वा अटैच टू द रूट ऑफ प्लांट्स इज फॉर. लार्वा कौन से में रूट्स के साथ अटैच होता है, बताओ जल्दी से. व्हाट डू यू वांट टू से, लार्वा किस में रूट्स के साथ अटैच होता है, एनोफ्लीज, मेंसोनिया, क्यूलेक्स या एडीज. व्हाट डू यू वांट टू से. लार्वा अटैच टू द रूट्स ऑफ प्लांट इज फॉर एनोफ्लीज, मेंसोनिया, क्यूलेक्स या एडीज. क्या बोलना चाहते हो, फटाफट से. लार्वा अटैच टू द रूट्स, एनोफ्लीज, मेंसोनिया, क्यूलेक्स. मेंसोनिया, एब्सोल्युटली करेक्ट. Very nice. Everybody answering this. Mensonia, it has to be B. Larva will attach to the roots. ये लो बेटा, आपके लिए एक और गिफ्ट तैयार है. ये एक फ्लैश कार्ड है. दिस इज अगेन अ फ्लैश कार्ड फॉर यू स्टूडेंट्स. आई वेरी सिंसियरली प्रे टू गॉड कि आप फटाफट से एग्ज़ाम अपना क्लियर करो एंड यू कम आउट विद फ्लाइंग कलर्स. ये फ्लैश कार्ड लो, इसके बाहर मच्छर के अंदर सवाल नहीं आएगा. एनोफ्लीज कैसे बैठता है, ऐसे अपना पिछवाड़ा उठा के बैठता है. एनोफ्लीज इज इंक्लाइंड. एनोफ्लीज में एनोफ्लीज द एनस पार्ट इज अप. एडीज इज पैरेलल टू ग्राउंड. एडीज जो है वो घर में योगा करके दिखाएगा आपको, वो घर के अंदर रहेगा. इट इज़ इंडोर बाइटर. क्यूलेक्स जो है ये गंदे पानी में रहता है. इट इज़ डर्टी मॉस्किटो और ये गंदे एरिया में रहता है. मेंसोनिया नहीं बेटा, ये PDF मैं देखूंगा अभी देना कि नहीं, अभी आप फोकस करो इसके ऊपर. मेंसोनिया जो है, मेंसोनिया ये पत्ते खाता है, ये प्लांट्स के साथ रहता है. रिमेंबर, क्यूलेक्स गंदे काम करता है ये डर्टी काम करता है. क्यूलेक्स गंदे काम करता है. एनोफ्लीज जो है, हंचबैक कौन सा है, हंचबैक इज अ क्यूलेक्स मॉस्किटो. ये बेटा एक स्लाइड दे रहा हूँ आपको, फ्लैश कार्ड है, इसको सेव कर लो एंड यही एग्जाम में आएगा, इसके बाहर नहीं आता. प्लीज रिमेंबर, न्यूसेंस मॉस्किटो इज अ क्यूलेक्स मॉस्किटो. न्यूसेंस मॉस्किटो. ये सारे वर्ड्स ना बड़ा इंटरेस्टिंग है. ये सारे वर्ड्स इनके, जैसे एनोफ्लीज को सोफिस्टिकेटेड मॉस्किटो मैं बोलता था, तो ये वर्ड्स मैंने इन्वेंट किए. मैंने एक दिन सोचा कि कैसे करूं, कैसे पढ़ाऊँ मैं स्टूडेंट्स को, तो दिमाग में आया चल एनोफ्लीज को सोफिस्टिकेटेड कर ले, बेचारा है वैसे ही पिछवाड़ा ऊपर करके बैठा है तो सोफिस्टिकेटेड ही होगा. सो एनोफ्लीज जो है इट इज़ अ सोफिस्टिकेटेड मॉस्किटो. एडीज जो है वी कॉल इट एज अ फियरलेस मॉस्किटो, क्योंकि ये टाइगर है तो एडीज को हम फियरलेस मॉस्किटो कह देते हैं. और ये मज़े की बात है, मेनी फैकल्टी स्टार्टेड यूजिंग दिस इन देयर बुक्स ऑल्सो. सो एनीवेज, दिस इज़ नॉट एनी यू कैन से टेक्निकल वे, बट ये बहुत साल पहले मैंने वैसे ही तरीके बनाए थे कि इसको हम ये बोलेंगे. अब ये बुक्स में भी आने शुरू हो गए. सो दैट जस्ट टेल्स अस कि कहाँ से जर्नी शुरू होती है. सो एनीवेज, फॉर योर एग्ज़ाम, आपने एग्ज़ाम करना है. अजीज़ मोहम्मद, वीडियो सेव करो. यस, वीडियो सेव करेंगे और ये वीडियो आपके लिए ही है. PDF यार देखो, पता नहीं कैसे बनती है. आई डोंट नो हाउ टू मेक दिस PDF. आई विल ट्राई टू शेयर इट विद यू. ये आपके लिए ही चीज़ है. वीडियो विल बी देयर, सो डोंट वरी अबाउट द वीडियो. नेक्स्ट सवाल देखते हैं. गलती मत करना. ये मच्छर के अंदर, मलेरिया के अंदर अगर तुमने गलती करी, आपके टेलीफोन स्क्रीन में से निकल के आपको एक पड़ेगी. सो मेक श्योर यू डू नॉट डू मिस्टेक ऑन मलेरिया, यू डू नॉट डू मिस्टेक ऑन एंटोमोलॉजी. उसमें गलती करी तो पड़ेगी, बहुत मेरे से पड़ेगी, क्योंकि ये मैंने अपने जी जान लगा के आपको पढ़ा रहा हूँ. आपको 1000 दफ़ा ये क्लासेस में पढ़ाया है. आई हैव ट्राइड टू टेल यू मिलियंस ऑफ टाइम्स इन द क्लास. मच्छर में गलती करी तो मेरा नाम डूबता है. मलेरिया में गलती करी, मेरा नाम डूबता है. सो प्लीज़ रिमेंबर, इनमें गलती नहीं करनी. ये आपको फ्लैश कार्ड्स हैं, ये आपके लिए हैं. Anyways, coming back to the question, which of the following statement is false for reduced osmolarity ORS? Very nice, very nice. I'm so happy for you. I am so happy for you. Which of the following statement is false for reduced osmolarity ORS? Very nice. मुझे लगा था कि ये क्वेश्चन मतलब स्टूडेंट्स नहीं मार्क कर पाएंगे. वेरी नाइस. बहुत काफ़ी लोगों ने बिल्कुल ठीक उत्तर दिया है. ऑस्मोलैरिटी इज 300 मिली ऑस्मोल्स. वेरी नाइस बेटा. प्लीज़ रिमेंबर, एक और फ्लैश कार्ड पीडियाट्रिक्स वालों ने मे भी दिया होगा, बट दिस जस्ट अ फ्लैश कार्ड नंबर 1088 ORS solutions के ऊपर there are 3 types of ORS. कुछ भी याद रखने की ज़रूरत नहीं है. You do not need to remember Rizomol क्या है and standard ORS. ये use नहीं होते. What we use today is this reduced osmolarity ORS. What we use today is reduced. ये भी काफ़ी दफ़ा स्टूडेंट्स को कन्फ्यूजन होती है कि सर रिड्यूस्ड ऑस्मोलैरिटी एंड रीजोमाल क्या सेम चीज़ है? नो, दे आर नॉट द सेम चीज़. रीजोमाल अलग है, रिड्यूस ऑस्मोलैरिटी अलग है. सो क्या बात है प्रवीण मुबरशा? एब्सोल्युटली करेक्ट. इट इज़ 245 मिली ऑस्मोल्स पर लीटर. एब्सोल्युटली करेक्ट. Chloride is 65, glucose is 75, sodium is 75, citrate is 10, and potassium is 20. So please remember, this is reduced osmolarity. It is used in India. It is WHO recommended. It is WHO recommended reduced osmolarity ORS. Which of the following is not a feature of cohort studies? Coming to the next MCQ. Which of the following is not a feature of cohort studies? क्या बोलना चाहते हो? Not a feature of cohort studies. Not a feature of cohort studies. Shows natural course, find incidence, find risk ratio from effect to cause. क्या है? Which of the following is not a feature? Which of the following is not a feature? Many students have answered D. Absolutely correct. From effect to cause, which of the following is not a feature of cohort studies? बहुत स्टूडेंट्स ने आंसर डी किया है. व्हाट इज़ अ कोहॉर्ट स्टडी? ऐसा नहीं करना. व्हाट इज़ अ कोहॉर्ट स्टडी नहीं पूछ सकते. अभी तो एग्जाम है आपका 10 दिन बाद है. यू कांट आस्क मी व्हाट इज़ अ कोहॉर्ट स्टडी. That is wrong answer. Wrong question, invalid question. But anyways, beta, cohorts are forward direction. Yes, they go from cause to effect. They go from cause to effect and not from effect to cause. So ये एक फ्लैश कार्ड आपके लिए पेश कर रहा हूँ. This is important फ्लैश कार्ड. MMFC. This is important फ्लैश कार्ड. ये फ्लैश कार्ड याद रखो. क्वेश्चन आएगा इसी में से आएगा. इसके अलावा कहीं से नहीं आएगा. हाज़र नाज़र मान के, भगवान को आप साक्षी मान के ये टॉपिक पढ़ लो. इसी में से सारी एपिडेमियोलॉजी का उद्धार हो जाएगा. सो प्लीज़ रिमेंबर, ये जो कोहॉर्ट स्टडीज़ हैं, कोहॉर्ट स्टडीज़ इज़ गोइंग टू टेल यू अबाउट द नेचुरल कोर्स ऑफ डिजीज़. इट इज़ गोइंग टू टेल यू अबाउट द नेचुरल कोर्स ऑफ डिजीज़. केस कंट्रोल स्टडीज़ रेट्रोस्पेक्टिव होती हैं. इकोलॉजिकल जो है कोरिलेशनल, क्रॉस सेक्शनल, ये प्रेवलेंस बताती हैं, ये बर्डन बताती हैं. क्रॉस सेक्शनल प्रेवलेंस बताती हैं, बर्डन बताती हैं. प्लीज़ रिमेंबर, cohort studies is also a study of choice for rare risk factors, whereas rare disease, the study of choice is a case control study. ये क्वेश्चन इसी में से आएगा. ये क्वेश्चन इसी में से आएगा. एंड दिस इज इम्पॉर्टेंट आपके लिए टेबल. Praveen Mubarsha, this is beta for FMG exam. नहीं, यू कांट. नहीं, USMLE अमृतांश चालू वाली है. शाबाश, पूरा चल रहा है जोश में अपना बंदा. Anyways, coming back to the story. Which of the following is not a feature of cohort study? Suman Charter. Suman Charter is, what do you think is the best answer? Suman Charter is what? Suman Charter is dignified care, incentive to mother for institutional delivery, screening for pregnant mothers, and screening for adolescent girls for anemia. What do you think is the best answer over here? क्या बोलना चाहते हो? What is Suman Charter? What is Suman Charter? Suman Charter. Suman Charter is dignified care, incentive to mother for institutional delivery, screening of pregnant mothers, a screening of adolescent girls for anemia. काफ़ी कह रहे हैं इंसेंटिव टू इंस्टीट्यूशनल डिलीवरी, इंसेंटिव टू मदर. इंसेंटिव टू मदर इज गिवन अंडर द GSY. ये सुमन नहीं है, इट इज GSY. और कुछ ट्राई करो. स्क्रीनिंग फॉर प्रेग्नेंट मदर, दिस इज व्हाट इज द प्रधानमंत्री सुरक्षित मातृत्व अभियान. That is wrong answer. Screening of adolescent girls for anemia. Screening of adolescent girls for anemia. It is under the Anemia Mukt Bharat. It is under the Anemia Mukt Bharat scheme. Screening of adolescent girls for anemia. So what is the best answer, beta? अब तो सब लोग सही कर लेंगे. अब सबका A आएगा. Very nice. वेरी नाइस. आफ्टर आई राइट एवरीथिंग अगर कोई ए देगा, इट इज डिग्निफाइड केयर. शाबाश. इट इज सुमन स्कीम. सुमन इज अ सुमन चार्टर इज टू प्रोवाइड डिग्निफाइड केयर विद क्वालिटी एंड with quality and dignified care. Dignified care, that is Suman Charter. So please remember, this is what is Suman Charter. ये एक it is like everything together. It is zero dose vaccination भी लगेगी, बच्चे को breast feeding भी होगी, 4 antenatal care checkups भी होंगे. It is management of sick neonates, use of child protection cards, and it is delivery, quality of delivery. There is zero expense and it is good quality of care. Good quality of care. It also includes drop back of the female from after discharge. After discharge. So please remember, this is good quality of care. It is good quality of care. Okay? चलो. एक सवाल आता है अबाउट RBS के. सवाल आता है अबाउट RBS के, राष्ट्रीय बाल स्वास्थ्य कार्यक्रम. राष्ट्रीय बाल स्वास्थ्य कार्यक्रम RBS के, दैट इज फॉर विच डिजीजेस? RBS के इज फॉर विच पीपल? लाइक who will be benefited with RBS के? RBSK is for 0 to 18 year children. It is for 0 to 18 year children. इसमें two new diseases have been added. Two new diseases have been added, that is tuberculosis and leprosy. Tuberculosis and leprosy screening has been added into it. TB and leprosy screening. TB and leprosy screening has been added into it. TB and leprosy screening has been added into it. It is for राष्ट्रीय बाल स्वास्थ्य कार्यक्रम RBS के, राष्ट्रीय बाल स्वास्थ्य कार्यक्रम. ओके, जो हमारे लेटेस्ट डेटा है ये भी आप याद रख लो. दिस इज अ फ्लैश कार्ड फॉर यू, सो यू कैन रिमेंबर दिस फ्लैश कार्ड. I'm just trying to give you a better view of this. So yeah, please remember, this is also a flashcard, MMFC flashcard for you. This is the latest data that we have. It was given in year 2022, end of the year 2022. The crude death rate is 19.5. Crude birth rate is 19.5, crude death rate is 6.0, and the infant mortality rate in India is 28. It is highest, the infant mortality rate is highest in the state of, it is maximum in the state of Madhya Pradesh, with the state of Mizoram taking as the lowest, that is 3. The under 5 mortality rate in India has been noted as 32. The total fertility rate in India is 2.0. The sex ratio is 1029. You can take a screenshot of this. This is also a 7-star MCQ. बहुत दफ़ा सवाल एग्जाम में पूछा गया है. So एक और सवाल आता है, what is the MMR? So this is a very recent November 2022 update for you. What is the MMR? The maternal mortality ratio in India is 97 per lakh live births. the maternal mortality rate, please remember maternal mortality rate अलग है, ratio अलग है. आपको पता होगा what is the maternal mortality ratio, that is number of maternal deaths divided by live births. आपको पता होगा what is a maternal mortality rate. Maternal mortality rate is number of maternal deaths divided by the females in WRA. It is divided by the females in reproductive age group, maternal mortality rate. So it is given as 6 per lakh females in the 15 to 49 year age group. The lifetime risk is 0.21%. That is the chance of female to die during or after the childbirth or puerperam stage. That is lifetime risk. It is 0.21. It was date of release for this data was November 2022. So this is a 5-star MCQ. तब आपका exam के questions बन रहे थे. So this could be asked in your exam. Make sure you get this question right. Anyways, coming to the next MCQ, contraception for a 4-week lactating female. क्या बोलना चाहते हो? Contraception for a 4-week lactating female is intrauterine device, combined oral contraceptive pills, अंतरा injection या today sponge. 4-week lactating female है. Which of the following is 4-week lactating female के लिए contraception of choice? We can just remove this today sponge. इसमें actually you can write another option E as Chaya tablet. So contraception for a 4-week lactating female. What do you think? 4-week lactating female. Contraception of choice. It is, please note, OC pills cannot be given. These are contraindicated. They are only given after 6 months after delivery. तो 4 हफ्ते बाद तो नहीं होगा. अंतरा इंजेक्शंस नहीं दे सकते. Today sponge, yes, it can be given, but it is usually not given in the puerperal stage because of risk of toxic shock syndrome. This was a kind of okay answer, but it is like plus or minus, I would say. But if you get the Chaya tablets, that is the best answer. Chaya tablets is the best answer. Intrauterine device का insertion या तो आप within 2 days करोगे, within 48 hours after delivery, or it is given after 6 weeks. After 6 weeks, intrauterine device भी 4 weeks पे नहीं लगेगा. So please note this question is important. ये एक छोटा सा table है. This is by the government of India, and this is the best table for what type of contraception, time of initiation of the postpartum family planning methods. हर female में breastfeeding, non-breastfeeding. Please remember, breastfeeding, non-breastfeeding, what is the contraception of choice to be given in these cases? You should be knowing this. This is important for your exam. This is a flashcard for you, and please make note of this flashcard. It will be kind of important topic. Next MCQ, demographic gap is maximally seen in what stage? Demographic gap is maximally seen in what stage? Stage 1, 2, 3, 4, 5. Demographic gap किस में ज़्यादा होता है? Gap किस में ज़्यादा होता है? What do you think is demographic gap? Is highest in which stage? Demographic gap is highest in. Absolutely correct. It is a very easy MCQ. I would grade this as a very easy MCQ. It is a frequently asked MCQ. So there is a flashcard for you. I'm giving you a flashcard. This is the flashcard number 1068, demographic transition model. Everybody said it absolutely correct, that demographic gap is maximum during end part of stage 2. It is maximum during end part of stage 2. This is a 7-star flashcard for you. So please make sure that you get this question right. Question आएगा demography में से तो इसमें से आएगा. Okay, so make sure you get this right. It is a kind of very important MCQ and very frequently asked MCQ. Very frequently asked MCQ. Coming to the next point, next question. So, which of the following is not correct for copper 375, not 275, copper 375. Which of the following is not correct for copper 375? Which of the following is not correct for copper 375? Valid for 3 to 5 years. Thread is blue-green in color. It has 375 square millimeters of the copper on arms and stem. Does not require a plunger rod for insertion. What do you think is not correct? Which of the following is not correct for copper 375? What do you think is not correct for copper 375? So it is valid for 3 to 5 years. Copper 375. Please remember beta, copper 375, it is called as a short-term IUCD. It is called as a short-term IUCD and this is correct. It is for 3 to 5 years. This is correct option. This is true. Right? Thread is blue-green in color. This is also correct. It is true. It is made up of a nylon material. It is made up of a nylon material. It has 375. So you all are answering different, right? So answer is C. माधव शर्मा काफ़ी देर से बेचारा C कह रहा है. A is absent. बिल्कुल ठीक कह रहे हो माधव. Very nice. A is the correct answer. It has 375 square millimeters of copper on the arms and stem. Stem तक तो ठीक था. Arms पे नहीं होता. So this becomes the false option. This becomes the false option because it is not there on arms. It does not require plunger rod for insertion. This is also true. So please remember D, B and C, they all are true. This is the only one which is the wrong answer and this is the answer that you're going to mark. Option number C, it has 375 copper on arms and stem. That is the wrong answer. Copper T 375. If you look at this copper T 375, what you look over here is a copper 375 and over here you see is a copper T 380A. 380A may you have the copper on the arms. Over here you do not have the copper on the arms and there is a nylon thread. It is blue-green in color and this is a white color thread. There's again a flashcard for you and it is frequently asked. This could be also your image-based question. This could also be your image-based question. Okay. By the way, I'm just telling you at the end of this session, I am going to discuss all the images and the logos which can be asked in your exam. So I have a collection of that also. And let's just finish off all the questions that can be asked in your exam. There's another flashcard for you, beta. What are the contraceptives which are present in India, which are available in India under the National Family Planning Program Mission Parivar Vikas? Contraceptions which are present available in India at the sub-center level, PHC, CHC, district hospital level under the National Family Planning Program, that is Mission Parivar Vikas. What are the contraceptions? We can have oral contraceptive pills, IUDs, Antara, Chaya, male-female condoms and permanent methods of family planning. There is only one natural method, that is the Tirumala method, that is cycle beads method. It is based on the calendar method, mostly used for uneducated female. So please note that these all are the temporary methods which are not natural methods. Temporary methods, and of course you have the permanent methods. Over here only one MCQ that I would like to discuss, that we also have the I pills or the easy pills. These are used for emergency contraceptions. They are used for emergency contraception. They contain levonorgestrel in the dose of 1.5 milligrams. It has to be taken within 72 hours of unprotected intercourse. Within 72 hours of unprotected intercourse, we take the person needs to take emergency contraception, easy pill or I pill, levonorgestrel 1.5 milligrams. LNG20 beta, LNG20, that is the other name for Mirena. Mirena is not available in the health program. Mirena is not available in the health program. This is just for a small clarification for you all. Okay. Next question. So sensitivity is, what do you think is sensitivity? Sensitivity is like sensitivity to hot and touch and cold and pressure and sensation, but there's also another type of sensitivity. Sensitivity is what? What is sensitivity? Sensitivity to what? Is true positive by total tested positive, true positive by total disease, true negatives by total healthy, or false positive by total disease? What do you want to say? What do you want to say? It is true positive by the total disease. Kya baat hai? Everybody is so brilliant and you all have studied very nicely. Very nice, Amritansh, Ayushi, Elsa, Prajit. It's not option number D. That is false positive. It is inverse of sensitivity. Hai na? Maybe mistake hua. That's okay. It's okay to make mistakes, beta. So very nice. You have understood it. Aziz Muhammad Bandana. Absolutely correct, beta. It is option number B. That is true positive by total disease. एक फ्लैश कार्ड दे रहा हूँ. इस फ्लैश कार्ड में टेक अ स्क्रीनशॉट. इसमें पूरा चैप्टर आ गया. दिस इज कंप्लीट चैप्टर. This complete chapter of screening of disease for you guys. This is Mukhmohit's flashcard for you, collection for you. So ये फ्लैश कार्ड में पूरी एक हमने पूरा चैप्टर डाल दिया. इसके अलावा एक बस चीज़ आपको और लिखनी है. सीरीज़ में and parallel में if you combine test in series and if you combine test in parallel in series, what will increase, sensitivity or specificity? If you combine the test in series, the specificity will increase. If you combine the test in parallel, the sensitivity will increase. ये complete करेगा आपका chapter. इसमें मैंने ये भी लिखा है which is a more serious error, false positive or false negative. False positive is more serious. Next question is causes of high false positivity. Why do we have high false positivity? It is low prevalence, low specificity and high sensitivity. What is diagnostic accuracy? What do you mean by the diagnostic accuracy? Diagnostic accuracy is given by the PPV. It is most affected by the prevalence. It is most affected by the prevalence. Prevalence is going to affect the PPV most. Okay. You should also know these four formulas. Very frequently they will ask you these four formulas. What do you mean by sensitivity, specificity, PPV and NPV? Very important formulas for your exam. So make sure you get this question right. Very easy, super duper MCQ. यहाँ पे आपने at least one question plus कर लिया. ये क्वेश्चन अगर आप छोड़ते हो, ये बहुत इजी क्वेश्चंस हैं एंड दीज क्वेश्चंस विल हेल्प यू लाइक कम बिटवीन दैट वो पासिंग मार्क्स येस और नो. ये डायरेक्ट क्वेश्चंस आते हैं एंड देयर इज नो लेफ्ट एंड राइट इन दिस. Coming to the next MCQ, what percentage of values will fall between dotted lines shown below? क्या बोलना चाहते हो? What percentage of values will fall between the dotted lines below? क्या बोलना चाहते हो? Between +1 and -1 standard deviation. तो ये इमेज में इन्होंने दे रखा है ना +1 -1 standard deviation. So between +1 -1 standard deviation, what do you want to say? Option A, very nice. So it is option number A, that is 68%. Please remember, direct MCQ, whenever you get a normal distribution curve, between ±1 standard deviation, we have 68%. Between ±2 standard deviation, we have 95%. Between ±3 standard deviation, we have 99% of the population which lies. This is a 7-star MCQ for you. Very important 7-star MCQ for you. आगे चलते हैं. So absolutely correct. The correct answer over here is 68%. Next question. Air quality index is considered satisfactory if it is below 10, 50, 100, 200. क्या बोलना चाहते हो? If it is between 10, 50, 100, 200. Air quality index. Air quality index. If it is between less than 10, less than 50, less than 100, less than 200. क्या बोलोगे? So if the air quality index, is taken as satisfactory, ये क्वेश्चन पूछ रहा है satisfactory किसको बोलते हो? So बिल्कुल ठीक है, satisfactory is less than 100. 50 to 100 is called as satisfactory. So correct answer over here is less than 100 is called as satisfactory. Less than 50 is called as a good air quality, satisfactory air quality. and less than 200 it is called as moderate air quality. Less than 200 it is called as moderate air quality. Moderate air quality. So ये air quality के parameters sometimes they ask you. It is also important for your exam, so make sure you get this right. This is about the air quality parameters. This is about the air quality parameters. Less than 50 it is taken as good. 50 to 100 is satisfactory. Less than 200 or 100 to 200, that is moderate air quality. चलिए आगे चलते हैं. Which of the following is not correct for monkeypox disease? Monkeypox या monkeypox जो भी कहना है. So what is it like? Which of the following is not correct? Which of the following is not correct? It is now renamed to mpox. It is a highly fatal disease associated with immunodeficiency states. Classical acne-like rash on face and limbs. What do you think? What do you think is the correct answer here? Beta, it has now been renamed to mpox. This is true option. Because just to stop the stigma from monkeys, it is now renamed to mpox. It is a highly fatal disease. This is a wrong answer. This is wrong answer. It is not fatal. It is associated with immunodeficient state. That is true. And it causes acne-like rash on face and limbs all over the body. This is also true. So absolutely correct. It is not a fatal disease. A flashcard for you for the monkeypox. So monkeypox, it has now been renamed to mpox. It is from the variola virus family, and you can just remember that it is self-limiting with less than 1% fatality rate. The illness typically lasts 2 to 4 weeks. The main characteristic feature of the monkeypox is that a rash that looks like pimples or blisters that appear on face, inside the mouth or other parts of the body. That's the only thing. Otherwise, you have like fever, myalgia, sore throat, lymphadenopathies and all these things. It's a very non-specific kind of disease. Only thing is that you have rashes, like pimple type rash all over the body, and respiratory mode of transmission. It is not a fatal disease. Monkeypox, a flashcard for you. Next question. There are 30 people at a camping site. Which of the following is the best method for waste disposal which is generated? What do you think? 30 people on a camping site. Which of the following is the best method for waste disposal? Waste disposal. क्या बोलना चाहते हो? Which is the best method for waste disposal? Waste disposal method. Absolutely correct. Many students have answered it, started answering. So it is waste disposal is burial method. It is burial method is the best method for temporary sewage disposal at campsites. So that is the burial method. It is burial method. Control tipping, dumping, composting is not at all possible. It is only for temporary method, and the best answer is temporary sewage disposal, that is using the burial method. Next, according to WHO, maternal mortality is defined as, what do you think maternal mortality is defined as? When do you say a maternal death? Maternal death is defined as when there is maternal death is defined as when there is a death of a female within how many days? Within 42 days of delivery. Within 42 days of delivery due to delivery or related causes, not including accidents or trauma. That is called as a maternal mortality rate or a ratio, right? So not including accidents or trauma. So absolutely correct. The answer is it is within 6 weeks of postpartum. It is within 6 weeks of postpartum. Absolutely correct. It is within 42 days or within 6 weeks of delivery. Very nice. More than one doctor opinion is required for doing MTP as per the latest regulations 2021. What do you think? As per the latest regulations 2021, so more than one doctor is required. Is required for how much time? After 6 weeks, after 20 to 24 weeks, up till 20 weeks, 12 to 24 weeks. What do you think is the best answer over here? More than one doctor opinion is required. So I think everybody knows about this. It is 20 to 24 weeks. Only one doctor till 20 weeks, two doctors from 20 to 24 weeks. After 24 weeks, we need a complete board which will decide. So medical board approval after 24 weeks, 1 RMP till 20 weeks, 2 RMP till 22 to 24 weeks. So please remember, this is the MTP Act amendments, MTP Act amendments, and that is 1 RMP till 20 weeks, 2 RMP 20 to 24 weeks, and medical board approval after 24 weeks. This is also important MCQ for you. Which of the following is not a health provider posted at the village level? क्या बोलना चाहते हो? Which of the following is not a health provider posted at a village level? So Anganwadi worker. So they are at the village level. You know that one Anganwadi is for 800 population. Asha worker. These are also at the village level. You already know that one Asha is for 1000 population. हमने बात कर लिया. We've already talked in this. Trained birth assistant. These are also available at the village level. Usually we should have one TBA per village. And then you have the ANMs. These are auxiliary nurse midwives. These auxiliary nurse midwives, they are available at a PHC or above. And they are more specialized kind of nurses. So the best answer over here is option number A. Let us go to a next MCQ. So 30-year-old male member of a family from village in West Bengal presented with a chief complaint of diarrhea. On examination, it was noted that the patient has ascites and edematous extremities. On taking history, it was found that the patient was consuming mustard seeds from some local shop. Which of the following is the best possible diagnosis? So what do you think is the best answer over here? Very nice. You all have started answering this. This is option number B, epidemic dropsy. Because the patient is presenting with diarrhea and there is characteristic use of mustard seeds. Mustard seeds is mustard oil, which may be contaminated with what? With Argemone mexicana. And Argemone mexicana will contain what? It contains sanguinary toxin. So absolutely correct, beta. It is epidemic ascites. It is epidemic dropsy, not ascites. It is epidemic dropsy. That is Argemone mexicana. So absolutely correct. This is a frequently asked MCQ. So make sure you get sanguinary or epidemic dropsy questions right. Okay. I think I had a flashcard for you somewhere. I'm not able to find it. I will share with you this flashcard. So I'm writing it somewhere to share the flashcard with you for all the foodborne diseases. Right? Relative risk is calculated in which of the following studies? ये एक और question आया. Relative risk is calculated in which of the following studies? Cohort studies, case control studies, cross-section studies, या epidemiological studies. What do you think? So just now we talked about relative risk. Please remember, ये question मैंने इसलिए बनाया so that you already know that what is a relative risk. It should be there in cohort studies. In case control studies, we calculate the odds ratio. Okay. The relative risk if it is equal to 1, relative risk if it is more than 1, and if the relative risk is less than 1. या फिर वो पूछें odds ratio equal to 1, odds ratio more than 1, odds ratio less than 1. If the odds ratio is equal to 1, it means no association. If it is greater than 1, it means a positive association. If it is less than 1, it means a negative association. Please remember this. This is very frequently asked question. Cross section study prevalence के लिए होती है. Epidemiological study is just a filler. So the best answer over here is cohort study. Absolutely correct. It is cohort study. Absolutely correct. Right? तो डियर डॉक्टर साहिल मेडिक भाई मेरे कोई आंसर करो ना यार, फिर कोई क्वेश्चन का आंसर करो, तभी नाम लेने में मज़ा भी आएगा आपका. सो वी ऑल लव यू सो मच एंड थैंक you for being a part of this session. And many students have right now joined, and thank you so much to everyone for joining in. Let's move to the next MCQ. Which vaccine is given at birth? BCG, OPV, hepatitis B, BCG, OPV, hepatitis B, injectable, OPV, BCG, hepatitis B, DPT और BCG, MR and DPT. क्या बोलना चाहते हो? क्या बोलना चाहते हो? What do you think is the best answer? Which vaccine is given at birth? Which vaccine is given at birth? So absolutely correct, beta. At birth, we are giving the BCG, OPV and hepatitis B birth dose. Absolutely correct. At birth, we are giving BCG, OPV and hepatitis B birth dose. Very nice. So please remember, national immunization schedule. National immunization schedule is ultra important. Please make sure पूरा schedule पढ़ के जाना. I'm not wasting time on telling you the whole schedule again and again. Please remember, national immunization schedule is very important and it should be done by you all the time, right? So I'm just trying to show you the national immunization schedule, which is I'll send you a flashcard on the national immunization schedule, beta. Please remember, एक हमने already change बात की है, that is the inclusion of the FIPV. ये FIPV अब 3 doses में जाता है. It is given at 6 weeks, 14 weeks and 9 months of age. बाकी सारा हमारा national immunization schedule वही है, right? So make sure we get this right. Next question. In villages, first contact of people to medical healthcare is? In villages, first contact of people to healthcare, medical healthcare is primary, PHC, CHC, sub centers, multi specialty hospitals. क्या बोलना चाहते हो? क्या बोलना चाहते हो? In villages, first contact of people to medical healthcare is? So absolutely correct. Many students have started answering this. First contact of people to medical healthcare is? First contact is at the sub center. Wonderful answer. Everybody started giving C only. So absolutely correct. PHCs भी गांव में होते हैं, CHC भी गांव में होते हैं, hospitals भी we can have in the village. But the correct answer over here is first contact of people to the medical healthcare setup is a sub center. Nowadays the sub centers, they have been upgraded. We do not call these sub centers to sub centers. They have been upgraded to what? अगर कोई लिखना चाहता है, they have been upgraded to what? No, it is not first referral. They have been upgraded to what? They have been upgraded to what level? Sub centers. They have been upgraded to. So yes, students have, yeah, you all are correct. So they are upgraded to. Now beta, what center? You have to write the name. Yeah, absolutely correct. It is, yes, health and wellness centers. Yes, upgraded to health and wellness centers, HWC. This is under Ayushman Bharat scheme. Under Ayushman Bharat scheme, we have these CHOs also. CHOs, these are community health officers. These are very high profile nurses, I would say. Community health officers. These are very high profile, highly educated nurses, and in fact the syllabus for CHOs and for all the doctors, it's almost the same, and they are almost working like doctors, but of course they are nurses by occupation and by profession, and by educational qualification they are nurses, and they are community health officer. They are available at a health and wellness centers. All the sub centers, they have been upgraded to health and wellness centers. In fact, now all the places where the PHCs are also not very nicely functioning, we now have the medical officers, plus we also have the CHO sitting at the PHCs also. Anyways, let's move to the next MCQ. Leading cause of under 5 mortality. Now, this is a big controversial question because of the different types of reports that were generated by Government of India in year 2021 and 2022. What you are going to mark for your exam, that is what I am going to discuss right now. Leading cause of under 5 mortality is pneumonias, septicemia, hypoxia, prematurity. What do you want to answer? Pneumonia, septicemia, hypoxia, or prematurity? Leading cause of under 5 mortality. क्या बोलना चाहते हो? Leading cause of under 5 mortality. देखो, अगर क्वेश्चन आ जाए leading cause of under 5 mortality, okay? So infant mortality rate का जो leading cause है, why do children die in India? That is low birth weight and prematurity. That is low birth weight and prematurity. ध्यान से सुनो इस बात को. That is low birth weight and prematurity. But एक रिपोर्ट आया था, रिपोर्ट by medical certificate cause of death by Government of India, medical certificate cause of death. Medical certificate cause of death. Now, what do you mean by the medical certificate cause of death? इंडिया में अगर किसी बच्चे की लेस देन 1 ईयर की डेथ होती है, देर आर हाई चांसेस कि उस बच्चे का ना इंडिया जैसे देश में मेडिकल सर्टिफिकेट ही नहीं बनता, बिकॉज द बच्चा डाइड वेरी अर्ली इन स्टेज. तो मेडिकल सर्टिफिकेट के लिए जो सैंपल लिया गया था, दैट वाज अ लेस नंबर ऑफ चिल्ड्रन, एंड उन बच्चों में देखा गया दैट द मोस्ट कॉमन कॉज ऑफ डेथ बाय द मेडिकल सर्टिफिकेट causes, अगर मेडिकल सर्टिफिकेट्स देखो, देन द आंसर इज हाइपोक्सिया एंड बर्थ एस्फिक्सिया. सो यहां पे अगर आपको, देर आर 2 थिंग्स नाउ फॉर यू टू नो. इन केस द क्वेश्चन, लिसन वेरी वेरी केयरफुली राइट नाउ, very carefully. In case the question says under 5 mortality, infant mortality, अगर वो deaths के cause general पूछता है, general death के cause, then your general answer should always be low birth weight prematurity. This is the main cause. It is most important cause. In India, the most important causes are low birth weight and prematurity. This is a plus point for you. Okay, so plus point for you is low birth weight and prematurity. ध्यान से मार्क करना एग्जाम में. इन केस नथिंग इज सेड, जनरल बच्चा डेथ हुआ, व्हाट इज द मोस्ट कॉमन कॉज? लो बर्थ वेट प्रीमेच्योरिटी. बट अगर क्वेश्चन कहता है एज पर दी MCCD, इफ अगर ये क्वेश्चन ही MCCD का पूछ लिया, if the question says that as per MCCD what is the most common cause of death, then you can't write low birth weight, because the report itself says कि भैया the most common cause of death is hypoxia and birth asphyxia. These are clubbed under the perinatal causes. इनको हम कहते हैं perinatal causes which may cause the baby to die. So ले देके क्रक्स ऑफ द स्टोरी, मैं एंडिंग पे आ रहा हूं. समरी, व्हाट यू नीड टू रिमेंबर फॉर योर एग्जाम. ध्यान से सुनना इस बात को, ये आपका आंसर चेंज करता है. कॉजेज ऑफ इन्फेंट मोर्टैलिटी जनरली स्पीकिंग, अगर कुछ नहीं लिखा, इट इज लो बर्थ वेट एंड प्री मेच्योरिटी. अगर उन्होंने, इफ दे आर स्पेसिफिकली आस्किंग अबाउट MCCD रिपोर्ट, देन योर आंसर हैज टू बी hypoxia. But agar if nothing is mentioned, nothing mention, or if they say SRS data, or if they say NFHS data, then your answer is low birth weight prematurity. अगर उन्होंने नाम ले लिया MCCD का, ओनली देन यू नीड टू मार्क हाइपॉक्सिया एज द सिंगल बेस्ट आंसर. Neonatal mortality भी same answers है. Early neonatal mortality is also same answers. Now coming to under 5 mortality. Under 5 mortality means all the children who are under 5 deaths. The under 5 mortality rate in India is 32 and infant mortality rate in India is 28. So under 5 mortality is 32. 32 में से 28 children die in the infant period. So answer इसका भी same रहेगा. But if they ask you about child death rate, अब ये child death rate क्या होता है? Child death rate is 1 to 4 years of age. चाइल्ड डेथ रेट इज डेथ ऑफ ए चाइल्ड आफ्टर 1 ईयर. ध्यान से सुनना इस बात को. चाइल्ड डेथ रेट इज डेथ ऑफ चाइल्ड आफ्टर 1 ईयर बट लेस देन 5 ईयर्स. 1 साल के बाद 5 साल से पहले. सो आफ्टर 1 ईयर बट लेस देन 5 ईयर्स उस एज ग्रुप में इट इज डेथ ऑफ चिल्ड्रन एज 1 to 4 years divided by the total children in age 1 to 4 years. into 1000. That is what is child death rate. अब यहाँ पे चेंज हो गया. Now you cannot answer hypoxia and low birth weight क्योंकि बच्चा बड़ा हो गया. After 1 year की डेथ हो रहा है ना. यहाँ पे most common cause could be infections, could be pneumonias, could be diarrheas, but most importantly it is septicemias and malnutrition. So यहाँ पे आ गया malnutrition, septicemia. अगर आपको रिपोर्ट आ गया MCCD का, all the time best answer is septicemia over here. But अगर क्वेश्चन में क्वेश्चन पूछते हैं कि which is more common infection, pneumonia or diarrhea, it is pneumonias are more common than diarrheas. As a cause of death, I'll take a separate page and write it. As a cause of death, pneumonias are more common than diarrheas as a cause of death. होता क्या ज्यादा है? डायरिया ज्यादा होता है. मरता किससे ज्यादा है? निमोनिया से मरता है. याद रखना इस बात को. फेटालिटीज आर मोर ड्यू टू निमोनियाज वेयर एज द मॉर्बिडिटी इज मोर ड्यू टू डायरियाज. You listen to these incredible important lines by the National Health Mission. They say that the fatalities are more with the pneumonias whereas the morbidity is more with the diarrheas, and it is imperative, it is important by the government of India to take care of both these diseases, pneumonias and diarrheas. मरता निमोनिया से ज़्यादा है, होता डायरिया ज़्यादा है. ये बातें मेरी याद रखना, एग्जाम में कहीं ना कहीं काम आएंगी. These are important top points for you. Please remember, if the question says MCCD तब ये आंसर करना है, otherwise जनरल आंसर करो low birth weight and prematurity. Okay, so coming back to this game, what is the best answer? Leading cause of under 5 mortality. Nothing asked, nothing very hi-fi. Pneumonias, yes, it is there. Septicemia is more in 1 to 4 year age group. Hypoxia, yes, it could be there, but as per MCCD report, prematurity is the best answer, general best answer. General single best answer over here is prematurity as a single best answer. So अगर MCCD पूछता है MCQ वाला तो मैं hypoxia मार्क करता. If the question had asked about 1 to 4 years तो मैं septicemia. अगर leading cause of death वो पूछता तो it is pneumonia. कोई शक? Please ask me. If any doubt, please ask me. I'm waiting for any doubts. This is a big topic, headache topic for me. I had to clarify this so that you all are going to the exam with full confidence. दिमाग में शंका नहीं ना होगी, शक नहीं होगा, तो हमेशा आपका कॉन्फिडेंस ऊपर रहेगा. एंड नॉलेज इज पावर, राइट? नॉलेज इज पावर. द मोर नॉलेज यू हैव, द मोर कॉन्फिडेंट यू बिकम. अदरवाइज वो इधर उधर की बात होती रहती है. समझ में आ रहा है आपको ये? Any doubt, you are most welcome to ask. Any doubt, you're most welcome to ask. Let me move on to the next MCQ. कोई सवाल है तो पूछ लो बेटा. कोई भी डाउट नहीं रखना दिमाग में. All are present at CHC except. कुछ भी डाउट है, आड़ा टेढ़ा कुछ भी डाउट है, पूछो. दिल खोल के पूछो आज. So, all are present at CHC except, what do you want to say? Surgeon, blood storage, treatment of specific genetic or congenital and first referral units. All are present at CHC except all are present at CHC except beta CHCs में we do have at a CHC we have a medical officer plus we have specialist. The specialist could be medicine, surgery, gynae, peds, plus ophthalmologist, plus we also have anesthesiologist. अब जो CHC है, they have been upgraded. CHCs have been upgraded to dash centers. क्या बोलना चाहते हो? CHCs have been upgraded to dash centers. What do you want to say? जो बेटा CHC है, community health center. CHC stands for community health centers. The CHC, community health centers, they have been upgraded to क्या बोलना चाहते हो? CHCs have been upgraded to what? CHCs have been upgraded to dash centers. They have been upgraded to FRUs. सही बोल रहे आप लोग. They have been upgraded. अब FRU क्या होता है? First Referral Units. जो अभी सवाल भी किसी स्टूडेंट ने अभी पूछा था, First Referral Unit क्या है? तो First Referral Unit कौन से होते हैं? They are upgraded CHCs. Health Centers, सब सेंटर्स दे हैव बीन अपग्रेडेड टू हेल्थ एंड वेलनेस सेंटर्स. अब ये जो FRUs हैं, यहाँ पे ब्लड फैसिलिटी होगा, ब्लड फैसिलिटी, ब्लड स्टोरेज फैसिलिटी होगा. Blood storage facility is present there. So surgeon, will it be present? Yes, surgeon is there. Blood storage, yes. Specific genetic and congenital conditions, this is not available. First referral unit, yes, these are first referral units. So best answer यहाँ पे मैं क्या मार्क करूँगा? मैं तो genetic करूँगा, because genetic के conditions cannot be handled at a CHC level. So I think it's a very easy, simple MCQ. इसको गलत नहीं करना. It is specific genetic या congenital conditions which cannot be actually tackled at all the conditions cannot be actually tackled at a community health center level. How to compare life expectancy of two different countries? बहुत स्टूडेंट ने ये डाउट पूछा मेरे को, तो मैंने कहा इसको क्वेश्चन को ही डिस्कस करते हैं. How to compare life expectancy of two different countries? QALY, DALY, HDI या HPI? What do you think? QALY, DALY, HDI और HPI? So how to compare life expectancy of two different countries? Two different countries का life expectancy अगर आपने compare करना है, you have to compare it using the Human Development Index. Human Development Index is the best answer. Please remember, आपके पास 3-4 चीज़ें हैं. What is HDI? HDI हमने बात किया था, Human Development Index. It takes into account life expectancy at birth plus knowledge level, that is the school average school years and the expected school years, plus it takes the gross national income. ठीक है. What is DALY? DALY जो होता है Disability Adjusted Life Years. Disability Adjusted Life Years, सवाल डायरेक्ट MCQ आता है आपके ऊपर कि ये किसके लिए होता है. It is to find the burden of disease. And DALY is the best measure for burden. इसके अंदर दो चीज़ें होती हैं. It takes into account premature deaths plus number of years lived with disability. Number of years lived with disability plus premature deaths. That is what is DALY. Okay. What is QALY? QALY stands for Quality Adjusted Life Years. QALY stands for Quality Adjusted Life Years. It is the best measure to assess the effectiveness of an intervention. It is the best measure to assess the effectiveness of an intervention. That is what is QALY. So QALY जो है उसको आप कब मार्क करोगे? To check the effectiveness of intervention. DALY आप कब मार्क करोगे? If the question says number of years lived and premature deaths, burden of disease. HDI लाइफ एक्सपेक्टेंसी नॉलेज और GNI ग्रॉस नेशनल इनकम बताता है. HPI ह्यूमन पॉवर्टी इंडेक्स है. इट इज ऑपोजिट ऑफ HDI. सो लाइफ एक्सपेक्टेंसी आपने HDI से मार्क करनी है. एब्सोल्युटली करेक्ट. मेनी स्टूडेंट्स आंसर दिस करेक्ट. सो दिस जस्ट अ स्मॉल स्क्रीनशॉट यू कैन टेक ऑफ दिस. लॉट ऑफ क्वेश्चंस आर बीइंग आस्क्ड ऑन दिस. ओके. इसमें एक और क्वेश्चन डाउट आता है आपको. हेल क्या होता है? हेल कहाँ पे यूज करते हैं? हेल स्टैंड्स फॉर हेल्थ एडजस्टेड लाइफ एक्सपेक्टेंसी, जो हेल्थ एडजस्टेड लाइफ एक्सपेक्टेंसी है, इट इज टू टेल यू व्हाट, इट इज टू टेल यू द अबाउट द हेल्थ स्टेटस ऑफ द पॉपुलेशन, हेल्थ स्टेटस ऑफ द कम्युनिटी इज गिवन बाय द हेल. सो बर्डन के लिए आप क्या मार्क करोगे बेटा? जस्ट टू समराइज, बर्डन ऑफ डिजीज, दैट इज DALY. अगर आपको आए हेल्थ स्टेटस ऑफ पॉपुलेशन तो हम हेल मार्क करेंगे. अगर आपको आए इफेक्टिवनेस ऑफ इंटरवेंशन तो आपको क्वाली मार्क करना है. अगर क्वेश्चन आए लाइफ एक्सपेक्टेंसी, सेम क्वेश्चन, इफ दिस वाज द सेम क्वेश्चन, हाउ टू कंपेयर लाइफ एक्सपेक्टेंसी ऑफ 2 कंट्रीज, इसमें अगर ऑप्शन ई होता मेरे पास, यहां पे हेल होता, तो आई वुड हैव गॉन विद हेल. लाइफ एक्सपेक्टेंसी को कंपेयर करने के लिए, फॉर लाइफ एक्सपेक्टेंसी, HALE is a better indicator than HDI. HDI talks about the Human Development Index. Life expectancy, pure life expectancy देखना है, then you talk about the HALE. Burden of disease, DALY. Health status of population, you do HALE. Effectiveness of intervention, you do QALY. Okay? So these are small, simple MCQs. इनको एग्जाम के लिए गलती नहीं करना. ये 2 चार्ट्स हैं बेटा, एक इसका स्क्रीनशॉट ले लो. This is a 7-star MCQ. और ये एग्जाम से पहले एक दफ़ा देख लो, अभी देख लो, बस एग्जाम तो आया खड़ा. एंड दिस इज व्हाट इज इंपॉर्टेंट फॉर योर एग्जाम. लेट्स मूव ऑन टू द नेक्स्ट फ्यू एमसीक्यूज. थोड़े से एमसीक्यूज और डिस्कस करेंगे, बहुत रात भी हो गई है. सो ग्रुप ऑर्गेनाइज्ड अ मास गैदरिंग ऑन हैंड वॉशिंग एरियाज. लॉजिकल सीक्वेंस वुड बी, हाउ मेनी ऑफ यू आर विलिंग टू डू मोर एमसीक्यूज? अभी कितने लोगों में जोश बाकी है? क्या बोलना चाहते हो? कितने लोगों में जोश बाकी है? करना और पढ़ाई करना है, या थक गए, नींद आ रही है और ये कहाँ बोरिंग PSM में फंसे हुए हैं? How's the जोश? Like, what do you want to say? बोल तो सकते नहीं हो, बोल तो सिर्फ मेरे पास ही है माइक. आप लोग क्या बोलोगे? So, क्या बोलते हो इसमें? Group organized a mass gathering on health awareness. या अभी और करोगे? A group organized a mass gathering on health awareness. Logical sequence will be. ठीक है जी, करते हैं. अब आप लोग तैयार हो तो ठीक है, हम भी तैयार हैं. अगर आप लोग तैयार हो तो इसमें और क्या चाहिए मुझे, है ना? ये दिल मांगे मोर. ओ यस, इट इज मोस्ट इंपॉर्टेंट सब्जेक्ट. डर के आगे क्या होता है? डर के आगे क्या होता है? वो डर के आगे क्या है? व्हाट इज अहेड ऑफ डर? डर के आगे डैश है. आई विल पास, ऑफ कोर्स. सब लोग पास होंगे. जागरण करवा लो तुम मेरे से. जय माता की. सारे बोलो जय माता की. डर के आगे जीत नहीं है, डर के आगे सीख है. यही तो प्रॉब्लम है. डर के आगे जीत नहीं होता, डर के आगे सीख है, और सीखने के बाद जीत है. नहीं, डर के आगे जीत नहीं है मेरे दोस्तों, डर के आगे सीख है. डर के आगे सीख है, सीख के आगे जीत है. सीख के बाद आएगी जीत. जीतना इतना इजी नहीं है. डर के आगे सीख, सीख के आगे जीत. So make sure that you get this point right. Okay. So a group organized a mass gathering on hand washing awareness. Logical sequence will be. लॉजिकल सीक्वेंस विल बी. आ जाओ वापस फटाफट से MCQs के ऊपर आओ. अवेयरनेस, इंटरेस्ट, इवैल्यूएशन, एडॉप्शन. एडॉप्शन, इवैल्यूएशन, अवेयरनेस, इंटरेस्ट, इवैल्यूएशन, अवेयरनेस, इंटरेस्ट, एडॉप्शन, या अवेयरनेस, इंटरेस्ट, एडॉप्शन, इवैल्यूएशन. सो बेटा इसमें सबसे पहले जो सबसे पहले पेशेंट करेंगे दैट इज अवेयरनेस. अवेयरनेस के बाद डर के पीछे अपनी मुसीबत है. यस यस मुसीबत है. नाइस 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 इम्प्रोवाइजेशन. थैंक यू सो मच अंकित पांडे. बिल्कुल सही बोल रहा है ये. सो अवेयरनेस है. अवेयरनेस के बाद इंटरेस्ट पैदा होता है. इंटरेस्ट के बाद आप उसको adopt करते हैं and then you do evaluation. Okay, so absolutely correct, everybody is answering correctly. Awareness, interest, then you adopt it and then you evaluate कि हमने क्या किया क्या नहीं किया, and then you move forward with it. Absolutely correct. माधव शर्मा, आई एम सो सॉरी अगर आपकी पूरी इंग्लिश यूज होगी. सो मुसीबत के आगे डर है, डर के आगे सीख है, सीख के आगे जीत है. ये बनी सीक्वेंस. तो एक और सीक्वेंस है. विच ऑफ द फॉलोइंग इज द करेक्ट आंसर? मुसीबत, डर, सीख, जीत. ABCD. अरेंज करो. Arrange the following: ABCD. या BCAD या DACB, जो मर्जी कर लो. So that's what. So very nice, very nice. Let's move to the next MCQ. Let's move to the next MCQ. 5 मिनट की ब्रेक थी, आगे चलते हैं. इनको अरेंज करना है. So, the most common cause of childhood blindness is, please tell me, what is the most common cause for childhood blindness? Childhood blindness. Vitamin A deficiency, cataract, glaucoma, refractive errors. Most common cause of childhood blindness is vitamin A, cataract, glaucoma, refractive errors. So yes, absolutely correct. Most common cause of childhood blindness, जहाँ पे बच्चों के blindness की बात आती है, बच्चों के blindness ने it is vitamin A deficiency. It is vitamin A deficiency. यहाँ पे ना I would like to tell you 2 points over here. Yes, it is vitamin A. अजीज़ मोहम्मद जिंदाबाद. Yes, absolutely correct. आप हमारे सबसे सही उत्तर देने वाले स्टूडेंट हो. आप भगवान से मेरी पूरी प्रार्थना है कि फटाफट से ये जो स्टूडेंट्स आंसर कर रहे हैं इनका एग्ज़ाम में पास हो और आप अच्छे नंबर से आई विल पास बोलें. सो एब्सोल्युटली करेक्ट बेटा अजीज़ मोहम्मद, वेरी नाइस. कुछ भी लगा दीजिए, रहेंगी तो सब लाइफ की लाइफ में. ज़िंदगी तो चलती रहती है यार. दैट्स ओके. सो दैट्स अ पार्ट ऑफ द गेम. एनीवेज, कमिंग बैक टू द NPCB. बेटा NPCB, नेशनल प्रोग्राम फॉर कंट्रोल ऑफ ब्लाइंडनेस. NPCB वालों ने 2019 में 2019 में दे गेव अ रिपोर्ट. सो NPCB 2019 दे गेव अ रिपोर्ट. एंड उस रिपोर्ट में उन्होंने बताया दैट व्हाट इज द चांस ऑफ हैविंग ब्लाइंडनेस, व्हाट इज द मोस्ट कॉमन कॉजेज ऑफ ब्लाइंडनेस. प्लीज नोट दैट द मोस्ट कॉमन कॉज ऑफ ब्लाइंडनेस, मोस्ट कॉमन कॉज ऑफ ब्लाइंडनेस कहाँ पे होती है. अगर मैं एक सिंप्लीफाइड टेबल दूं, ये मैं सिंप्लीफाइड टेबल दूं, दिस इज अ सिंपल टेबल फॉर यू. Age less than 49 years and age more than 50 years. Age less than 49 and age more than 50 years. So less than 49, the visual impairment is primarily because of refractive errors, untreated cataract, globe abnormality, non-trachomatis. आपने एग्जाम के लिए बस ये याद रखना है, less than 49 years में रिफ्रैक्टिव एरर्स ज़्यादा ज़रूरी हैं. एज मोर देन 49 या 50 ईयर्स में कैटरैक्ट ज़्यादा ज़रूरी है. प्लीज़ रिमेंबर, बस यही मैं चाहता हूँ कि एग्ज़ाम के लिए आप याद रखें. लेस देन 50 ईयर्स में इट इज़ द रिफ्रैक्टिव एरर्स which are more important, and age more than 50 years it is the cataract which is more important. बस यही याद रखना है. बुजुर्गों में कैटरैक्ट की प्रॉब्लम एंड लेस देन 50 ईयर्स में रिफ्रैक्टिव एरर्स. चिल्ड्रन में, चाइल्डहुड ब्लाइंडनेस में इट इज़ विटामिन ए डेफिशिएंसी. It is vitamin A deficiency in childhood, and refractive errors less than 49 years, more than 50 years it is cataract. एक तो ये बात याद रखनी है. दूसरी बात याद रखनी है, when do we categorize blindness. देखो, blindness को पुराने टाइम पे they used to categorize it as, पुराने टाइम पे they used to categorize it as social blind, manifest blind, ये blind, वो blind, but now it is taken as we can either have blindness or we can have visual impairments. When do we say blindness बेटा? Blindness is, ये मैं बहुत दफ़ा पढ़ा चुका हूँ, बहुत दफ़ा मैं क्लासेस में डिस्कस कर चुका हूँ. When do you say blindness? Blindness is when there is visual acuity less than 3/60 in the better eye with available correction. In the better eye with available correction, blindness, visual acuity of less than 3/60 is called as blindness. If the visual acuity is more than 3/60 in the better eye with available correction, then it is not blindness, it comes under visual impairment. ये पुराना टाइम था जब हम इसको social blindness, manifest blindness, this blindness, that blindness बोलते थे. Now it is not called as all those types. We have severe visual impairment, moderate visual, early visual impairment या simple visual impairment. When do you say visual impairment? If the visual acuity is less than 6/18 with the better eye with the available correction. Simple question, simple आंसर. ये ज़रूर याद रखना, ये प्रोस्पेक्टिव एमसीक्यू है, ये प्रोस्पेक्टिव एमसीक्यू है, ये क्वेश्चन है प्रोस्पेक्टिव एमसीक्यू. सो दिस इज अ स्मॉल टेबल फॉर यू टू रिमेंबर फॉर योर एग्जाम. टेक अ स्क्रीनशॉट ऑफ दिस एंड कीप इट सेफ विद यू. ये एग्जाम में पूछा जा सकता है, ये आपके लिए काम आएगा. सो दिस इज MMFC, दिस इज अ 7-star MCQ पॉइंट. ब्लाइंडनेस के ऊपर क्वेश्चन आ सकता है. इसके अलावा मैं एक और बात आपसे कहूँगा, दैट इज़ अबाउट द नॉन कम्युनिकेबल डिजीज़. नॉन कम्युनिकेबल डिजीज़ में 2025 तक के हमारे कुछ गोल्स हैं. वी वांट टू अचीव एसेंशियल NCD नॉन कम्युनिकेबल डिजीज़ की मेडिसिन्स एंड दे शुड बी हैविंग 80% कवरेज, 50% ड्रग थेरेपी का कवरेज, हाउस होल्ड रिडक्शन, डायबिटीज़ ज़ीरो होना चाहिए. इंपॉर्टेंट इज टोबैको कितना कम होना है. Tobacco, we want 30% reduction, reduced by 30%. We want physical, ध्यान से सुनना, physical inactivity. It is not physical activity. It is physical inactivity. मतलब जो मैं और आप अभी कर रहे हैं, हम बैठे हुए हैं, ये बैठे रहने को we want less than 10% reduction. We want more than 10% reduction. We want 10% reduction, tobacco 30%, salt intake should also be 30% reduction. 10% for physical activity, 10% for alcohol. 10% reduction. याद रखना, activity, alcohol. Activity, alcohol 10% है. Okay? Salt and tobacco 30% है. याद रखोगे ये? Salt and tobacco is 30%. Then you have physical activity and alcohol, that is 10%. So we want reduction in all this. इसके अलावा hypertension में कितना reduction चाहिए? We want reduction in the blood pressure levels to 25% reduction. 25. ये NCD के goals हैं, ये याद रखने बहुत ज़रूरी हैं, ये आपके एग्ज़ाम में आ सकते हैं. These are important. This is again a 7-star MCQ for you. So hypertension reduction of, say with me, please remember, you need to speak it. बोलो मेरे साथ. Activity, physical inactivity and alcohol कितना कम करना है? 10% कम करना है. 10 से ज़्यादा हमें कम करना है. Smoking and salt intake. Smoking and salt intake को 30% कम करना है. Smoking and salt intake. S से smoking, S से salt होता है. Salt and smoking को आपने कितना करना है? 30%. एक्टिविटी, इनएक्टिविटी या फिर अल्कोहल को कितना करना है? 10%. बीपी को कितना रिड्यूस करना है? 25%. ये आपको याद करना पड़ेगा, ये बहुत दफ़ा पूछा जाता है बेटा. ये एग्जाम में इट इज़ फ्रीक्वेंट. या स्मोकिंग एंड सॉल्ट 30%, अल्कोहल एक्टिविटी 10%, बीपी 25%. ये याद रखना है. कैन यू डू दैट फॉर मी? दिस इज इंपॉर्टेंट पॉइंट फॉर यू. ओके, सो मेक श्योर यू गेट दिस क्वेश्चन राइट. ये नॉन कम्युनिकेबल डिजीज़ के ऊपर काफ़ी सवाल आ सकते हैं. नॉन कम्युनिकेबल डिजीज़ आजकल ट्रेंडिंग टॉपिक है. नॉन कम्युनिकेबल डिजीज़ इज ट्रेंडिंग टॉपिक स्पेशली आफ्टर कोविड-19. जो ये आप लॉन्ग कोविड देखते हो ना, सुना होगा आपने, लॉन्ग कोविड सिंड्रोम है, LCS कहते हैं, लॉन्ग कोविड सिंड्रोम. दैट इज़ मोर लाइक पीपल टेंड टू गेट पेरिकार्डाइटिस, पीपल आर गेटिंग लाइक कार्डियक फेलियर्स. सो ये इन एरियाज़ में वी नीड टू बी केयरफुल. सो देयरफॉर ये एग्ज़ाम भी बन सकता है. ओके, चलो लेट्स मूव फॉरवर्ड. इस क्वेश्चन का आंसर क्या है? विटामिन A डेफिशिएंसी. एब्सोल्युटली करेक्ट. लेट अस मूव टू द नेक्स्ट वन. पर्सनल प्रोटेक्टिव इक्विपमेंट एज फेस शील्ड्स आर डिस्पोज्ड ऑफ इन. क्या बोलना चाहते हो? पर्सनल प्रोटेक्टिव इक्विपमेंट एज फेस शील्ड्स आर डिस्पोज्ड ऑफ इन. कहाँ पे डिस्पोज ऑफ करते हैं? बेटा प्लीज नोट दैट पर्सनल प्रोटेक्टिव इक्विपमेंट पीपीई में 6 एलिमेंट्स होते हैं। सबसे ऊपर हमारा आता है हेड कवर, देन आती हैं आई गॉगल्स, आई कवर या गॉगल्स या फेस शील्ड, फिर आता है हमारा फेस मास्क, देन वी हैव ग्लव्स, देन वी हैव एप्रन एंड लास्ट में हमारा आता है शू कवर। ये हमारे 6 एलिमेंट्स होते हैं पर्सनल प्रोटेक्टिव इक्विपमेंट के। सो ये जो हेड कवर है बेटा, हेड कवर दैट विल गो टू द येलो कैटेगरी। जो आई कवर है, गॉगल्स, फेस शील्ड्स, दे विल गो टू द रेड कैटेगरी। फेस मास्क गोज टू द येलो कैटेगरी, ग्लव्स विल गो टू द रेड कैटेगरी, एप्रन विल गो टू द येलो कैटेगरी अगर वो नॉन प्लास्टिक है। अगर वो प्लास्टिक है, इन केस ऑफ प्लास्टिक एप्रन, तो फिर वो जाएगा रेड कैटेगरी में। ओके, प्लास्टिक एप्रन अगर होगा तो वो रेड में डालना है। शू कवर गोज टू द येलो कैटेगरी। बस बात खत्म होगी। सो इसमें personal protective equipments as face shields, they are disposed of in which category? Face shields will directly go to the red category. The best answer over here is the red category. A very quick review about the biomedical waste. जो स्टूडेंट्स अभी लेट ज्वाइन किए हैं, मैं आपको बता दूं, ये वीडियो शुरू से देख लेना। मैंने स्टार्टिंग में आई डिस्कस्ड ऑल द कंट्रोवर्सीज। 5 कंट्रोवर्सीज, बड़ी कंट्रोवर्सीज मैंने ख़त्म करी थी अबाउट व्हाट इज़ पेरीनेटल मोर्टालिटी, रेबीज़ को कैसे मैनेज करना है, इसका गवर्नमेंट ऑफ इंडिया का क्या स्टैंड है, WHO का क्या स्टैंड है, नेशनल लेप्रेसी के ऊपर हमने बात करी थी, बायोमेडिकल वेस्ट मैंने बात कर ली है, ये सब चीज़ें कहाँ जाती हैं, आशा के ऊपर हमने बात कर लिया। ऑल द स्टूडेंट्स हु जॉइंड इन लेट, आई एम जस्ट टेलिंग यू, वीडियो की शुरुआत ज़रूर देख लेना। 30 minutes of the initial 20 minutes I think of the initial part of the video was pertaining to discuss all the controversies. Okay, so make sure you do that. Coming back to my question, personal protective equipments as face shield are disposed of in red category. A very quick review. ये एक screenshot ले लो बेटा. This is about the biomedical waste categorization. We can have something called as the biomedical waste or the general waste, that is the solid waste, or we can have the other waste. Which waste are not included in the biomedical waste? I don't know if you can see it, but please note that the which waste is not included in the biomedical waste. Batteries waste, e-waste, electronic waste, and the radioactive waste. Batteries waste, electronic waste, and the radioactive waste, these are not part of the biomedical waste. They are taken as other waste categories. Okay, so I hope you will remember this. These are other waste categories. So let me just go back to, for you to take this screenshot. इसका screenshot ले लीजिए आप. And this may be helpful for you. Okay, this may be helpful for you. So this is categorization of the waste. Please remember that what is the yellow waste? You dispose of everything which is like anatomical organs like placenta हो गया, fetus हो गया, soiled waste. Everything goes into the yellow category. Beddings and linen also go to the yellow category. Discarded beddings and linen, they also go to the yellow category. Microbiological waste, very important, frequently asked question होता है microbiological waste, जिसमें blood bags आ गए आपके, live vaccines, unopened vials, ये सारे भी आपके yellow category, right? So then cytotoxic waste, expired drug medicines, all are under the yellow category. Yes, ये वीडियो रहेगा बेटा, you need to remember this, ये वीडियो रहेगा. So ये वीडियो रहेगा. मोदी जी, माधव शर्मा, तो भाई कहाँ क्या चीज़ कंपेयर कर रहे हो भाई. चलो नेक्स्ट इज रेड कैटेगरी. रेड कैटेगरी में बेटा प्लीज़ रिमेंबर, इसका भी स्क्रीनशॉट ले लो. आई वुड रिकमेंड यू टू टेक अ स्क्रीनशॉट. इसको भी याद रखो, रेड कैटेगरी में सारा कुछ जो प्लास्टिक है, like Foley's catheter, Eurosac, IV bottle, rubber gloves, syringe without needle, vacutainer जिसमें blood ना हो. अगर vacutainer with blood आएगा तो that will go to the yellow category. Ryle's tube ये सब कुछ red category में. Broken vial, broken ampule, empty vial, unopened vial with live vaccines, they will go to the yellow category. Body, metallic body implants and orthopedic implants, they all go to the blue category. Sharps, all sharps, they will go to the white category. All sharps will go to the white category. ठीक है, ये हो जाएगा. ये बायोमेडिकल वेस्ट एक क्वेश्चन आएगा, एक इसका स्क्रीनशॉट ले लो, अभी बैठ के पढ़ लेना, और एक इसका ले लो. दैट्स ऑल. ओके, लेट्स मूव टू द नेक्स्ट एमसीक्यू. विच ऑफ द फॉलोइंग इज अ फ्ली बॉर्न डिजीज. ये भी बड़ा फ्रीक्वेंटली आस्क्ड क्वेश्चन है बेटा, frequently asked question hai. In a question anatomical yellow and syringe with needle white, which one? In a question anatomical is yellow and syringe with needle goes to white, which one to select? Beta Ankit, I could not get your question, but जो मुझे समझ में आया, anatomical body parts they go to yellow category. This is correct. Syringes with fixed needles they go to the white category. This is also correct. Syringes without needle, that is red. So ये option है. Okay. First sign night blindness, first symptom conjunctival xerosis, clinical white hot spots. Is this correct? अभी मैं बताता हूँ white hot spots का. Vitamin A के ऊपर ये क्वेश्चन बस उठा लिया तो ये कवर कर लेना. जस्ट आई टॉक अबाउट अमृतांश, आई जस्ट डिस्कस दिस क्वेश्चन. ये कर लो पहले. विच ऑफ द फॉलोइंग इज अ फ्ली बॉर्न डिजीज. फ्ली बॉर्न इनमें से कौन सा लगता है आपको? एंडेमिक टाइफस, एपिडेमिक टाइफस, क्यू फीवर, स्क्रब टाइफस. क्या लगता है? विच ऑफ द फॉलोइंग इज अ फ्ली बॉर्न डिजीज. एपिडेमिक टाइफस, एंडेमिक टाइफस, क्यू फीवर, स्क्रब टाइफस. क्यू फीवर. नीरज मिश्रा, वेरी नाइस, थैंक यू सो मच. नीरज ने बिल्कुल सही दिशा में, मतलब उसने ना कॉम्प्लेक्स प्रॉब्लम को सॉल्व करा. कहता कि भाई क्यू फीवर में देर इज नो वेक्टर. ये रट लो भैया आप. क्यू फीवर में कोई वेक्टर नहीं होता. क्यू फीवर में क्या आप जानते हो? देर इज नो रैश ऑल्सो. आपने वेक्टर बोला तो मैं आपको बात बताता हूँ. क्यू फीवर इज द ओनली डिजीज विच इज विद फीवर, ओनली रिकेट्सियल डिजीज विद फीवर विदाउट रैश. बाकी सब में रैश होता है. क्यू फीवर में ना तो रैश होगा ना तो वेक्टर होगा. वेरी नाइस. सो बिल्कुल ठीक है. क्यू फीवर तो बाहर हो गया. क्यू फीवर इज नॉट द आंसर. इट इज नॉट द आंसर. फ्ली बॉर्न बताना है. एंडेमिक टाइफस, एपिडेमिक टाइफस या स्क्रब टाइफस. ये किस तरह रट्टा मारो. ये मैं आपके लिए एक 5 स्टार 7 स्टार टेबल है. दिस इज अ फ्लैश कार्ड. 7 स्टार फ्लैश कार्ड फॉर यू. 7 स्टार फ्लैश कार्ड फॉर यू. एपिडेमिक टाइफस, एंडेमिक टाइफस, स्क्रब टाइफस, मेडिटेरेनियन स्पॉटेड फीवर, रॉकी माउंटेन रिकेट्सियल, क्यू फीवर, ट्रेंच फीवर. इसमें से जो एग्जाम में पूछते हैं, प्लीज रिमेंबर एपिडेमिक टाइफस, एंडेमिक टाइफस, स्क्रब टाइफस, क्यू फीवर. बस दैट्स इट. ये 4 चीजें कर लो. ठीक है. इनका अगर आप वेक्टर देखो, सब वेक्टर्स में कैन यू सी ऑल द वेक्टर्स. ऑल आर. कोई लाउज है, कोई माइट है, कोई टिक है, बहुत सारे हैं. लाउज माइट टिक, लाउज माइट टिक. एक इकलौता है जो फ्ली बॉर्न है. ये जो फ्ली बॉर्न है ये इकलौता घूम रहा है. विच इज द ओनली फ्ली बॉर्न डिजीज. दैट इज म्यूरिन टाइफस और ऑल्सो वी कॉल इट एज एंडेमिक टाइफस. ठीक है. इन सब में से कोई ना कोई वेक्टर है. एक इकलौता घूम रहा है जिसके पास कोई वेक्टर नहीं है. दैट इज नन. दैट इज क्यू फीवर. याद रखो क्यू फीवर. ओके. इन सब में, सब के अंदर जो रेजरवॉयर है, आप देखेंगे रेजरवॉयर, ये जो रेजरवॉयर है, ये रेजरवॉयर कहीं ना कहीं कोई जानवर है. एक इकलौता डिजीज है जिसमें द ओनली रेजरवॉयर इज अ ह्यूमन. ओनली रेजरवॉयर इज अ ह्यूमन. कौन है वो? ओनली रेजरवॉयर इज अ ह्यूमन. दैट इज ट्रेंच फीवर. Trench fever is the only one disease where the reservoir is human. बाकी सब में कोई ना कोई एनिमल है. rodents हैं, dogs हैं, sheep है, mice है, कुछ ना कुछ है. Epidemic typhus is also human and rodents both, right? But ये जो है ये trench fever होता ही humans में है. Trench fever reservoir is human. Okay. So बाकी incubation period if you want you can remember. India में very commonly we have epidemic typhus and India में very commonly we have epidemic typhus, scrub typhus. These are most common in India. Scrub typhus and epidemic typhus. Right? Donor granuloma is Q fever. Yes. सो इफ यू अंडरस्टैंड दिस रिकेट्सियल डिजीजेस, इसका एक स्क्रीनशॉट ले लो, प्लीज टेक अ स्क्रीनशॉट ऑफ दिस. बाद में पीडीएफ रहे ना रहे, आप मेरे साथ हो ना ही हो, कहाँ है मैं, कहाँ यू कहाँ, राइट. सो प्लीज नोट, ये आप यूज करो एज अ स्क्रीनशॉट्स एंड इसको आप करें. क्या क्वेश्चंस पूछ रहे हैं आप लोग? हिमांशु यदुवंशी अपकमिंग हेल्थ मिनिस्टर. भाई साहब यहीं पे हम यहाँ पे आपको पढ़ा के टीचर लोग ही ठीक है, आगे उगे कहाँ हेल्थ मिनिस्टर, कहाँ जाएंगे. यहीं पे खुश जितनी देर खुश हो ना, एंड दैट इज़ द बेस्ट थिंग. इससे ऊपर आकांक्षाएं तो कभी ख़त्म नहीं होंगी. तो थैंक यू सो मच हिमांशु, एंड प्लीज़ शेयर द पीडीएफ आई विल ट्राई टू शेयर. मैंने बताया ना बनाना पड़ेगा एंड कहाँ देना होता है, लेट्स सी. डोनट ग्रैनुलोमा हो गया. यूज थिक पेन एंड हाइलाइटर्स लाइक प्रीति शर्मा मैम. बिल्कुल जी, हम उनको फॉलो करेंगे. वेरी नाइस, आई विल ट्राई टू यूज. थैंक यू सो मच पिकल. नो सर पीडीएफ प्लीज. ओके सर, ओके पिकल जी, आपका नाम ही बड़ा. रैश ऑन पाम्स आर सीन इन सिवली डिजीज आर में. ठीक है जी, चलो लेट्स मूव फॉरवर्ड. एग्स आर इन्फेक्टिव फॉर्म एंड सो इसका क्या आंसर है? विच ऑफ द फॉलोइंग इज द ओनली फ्ली बॉर्न डिजीज? ओनली फ्ली बॉर्न डिजीज अभी हमने बात किया, इट इज म्यूरिन टाइफस और द एंडेमिक टाइफस. It is murine typhus or the endemic typhus that is the only flea-borne disease. This is the correct answer. Okay, let's move to the next. Eggs are infective form for. Eggs are infective form for. Yeah, Shubhash R and Dave, thank you so much for joining in and thank you so much for listening to all this PSM, right? Yeah, in Telegram group I will share. Eggs are infective. आ जाओ फटाफट से क्वेश्चंस करें यार, है ना. Eggs are infective form for Ankylostoma duodenale, Necator americanus, Wuchereria bancrofti, Escherichiasis lumbricoides. Eggs are infective form. Eggs are infective form, Ankylostoma duodenale, Necator. Absolutely correct. Absolutely correct. It is Escherichiasis lumbricoides. It is Escherichiasis lumbricoides. Eggs are infective form for Escherichiasis lumbricoides. बिल्कुल सही आंसर. Ankylostoma and Necator ये दोनों होते हैं hookworms. Hookworms में the larval stage is the infective stage. Wuchereria bancrofti बेटा, that is a parasite. It is a parasite and implicated in lymphatic filariasis. So वो worm itself जाता है Wuchereria bancrofti, Necator, and it is transmitted by the mosquito, Culex and the Mansonia mosquito for lymphatic filariasis. Absolutely correct. It is Ankylostoma. ये एक छोटा सा फ्लैश कार्ड है. This is MMFC flash card for you. So you get this right. Soil transmitted Escherichiasis hookworm whipworm. PSM से related MCQ आएगा अगर तो इसमें से आएगा, वरना नहीं आएगा. बस ये गारंटी है हमारी. आएगा तो इसमें से आएगा, नहीं तो नहीं आएगा. Please make sure that you get this question right. Soil transmitted helminthic infections. Soil transmitted helminthic infections, Escherichiasis hookworm whipworms. न्यूक्लियर बेटा माइक्रो का सवाल है, मेरे को इतना आता नहीं है. अंकित पांडे. सो दैट इज मोर फ्रॉम माइक्रोबायोलॉजी परस्पेक्टिव. इट्स नॉट माय एरिया, माय फोर्टे इज अबाउट स्टूल्स में कितने एग्स हैं, शैंडलर्स इंडेक्स क्या है एंड ऑल दैट. विच ऑफ द फॉलोइंग इज नॉट करेक्ट? फैट इनटेक is 25 to 50 grams, 40 grams for males, which is not correct. आपको गलत वाला ढूंढना है. 420 kilocals per day for third trimester pregnant female. Iron requirement in lactation is higher than in pregnancy. Vitamin C is used as prophylaxis in neurolatherism. क्या बोलना चाहते हो? Fat intake to be 25 to 40 grams, 420 kilocals per day for third trimester pregnant females. Iron requirement in lactation is higher than in pregnancy. Vitamin C is used as prophylaxis in neurolatherism. It's a difficult MCQ because मैंने बहुत सारे topics nutrition के combine करे हैं. But which of the following is not correct? And very nice. नीरज मिश्रा, सही छा गए यार तुम लोग. नीरज, very nice. असुनी, समीना, प्रियंका, नहीं, प्रियंका ने बी बोला है। नहीं, मेडिकल डॉक्टर, एल्सा, कैनी, असूना, अजीज मोहम्मद, वेरी नाइस, छा गए तुम लोग, वेरी नाइस। विच ऑफ द फॉलोइंग इज नॉट करेक्ट? Absolutely correct, beta. I'm so happy for all the students who have answered this. Very nice. So, which of the following is not correct? Fat intake to be 25 to 40. This is true. बेटा जो 420 कैलोरीज आप लोग गलत आंसर कर रहे थे ना, 420 कैलोरीज फॉर थर्ड ट्राइमेस्टर प्रेग्नेंट फीमेल, ये देखो, एक ये मैं चार्ट लेकर आया हूँ. दिस इज अ वेरी इंपॉर्टेंट 7-star चार्ट फॉर यू. ये न्यूट्रिशन, मैं सारा न्यूट्रिशन के 3 चार्ट्स देने वाला हूँ. 3 स्क्रीनशॉट्स ले लेना व्हेन आई टेल यू. अभी मत लो, मैं आपको बताऊंगा व्हेन टू टेक द स्क्रीनशॉट. सो अदरवाइज क्या फ़ायदा, मेमोरी ख़राब करोगे. किसकी मेमोरी? अपनी नहीं, फ़ोन की मेमोरी ख़राब करोगे. अभी मैं बताऊंगा कब स्क्रीनशॉट लेना है. सो एक याद रखो, 7-star पॉइंट है ये. प्रेगनेंसी में जो एक्स्ट्रा कैलोरीज आपने लेना है, प्रेगनेंसी में एक्स्ट्रा कैलोरीज वी हैव टू एडवाइज टू द फीमेल. फर्स्ट ट्राइमेस्टर में वेरी लेस कैलोरीज चाहिए, 75 to 80 कैलोरीज पर डे का एक्सेस चाहिए होता है. सेकेंड ट्राइमेस्टर में मतलब 4th मंथ के बाद 230 से 300 के करीब कैलोरी चाहिए. थर्ड ट्राइमेस्टर में 400 से 450 कैलोरी चाहिए. एवरेज जो जेस्टेशनल वेट गेन होता है, जो वेट गेन है, दैट इज 10 to 12 किलोग्राम्स ड्यूरिंग टोटल प्रेगनेंसी. सो लोअर वैल्यूज आप याद रख लो 10 के लिए, हायर वैल्यूज 12 किलोग्राम जेस्टेशनल वेट गेन में है. ओके, सो इनका अगर आप एवरेज लेंगे तो एवरेज विल कम आउट टू बी, द एवरेज विल कम आउट टू बी 310 to 375 किलो कैल्स. इसको हम गवर्नमेंट ऑफ इंडिया 350 किलो कैल्स पर डे एवरेज ले लेते हैं इन प्रेगनेंसी. बट दैट डज नॉट मीन कि टोटल फर्स्ट ट्राइमेस्टर में भी 350 कैलोरी चाहिए. That does not mean that in the first trimester, okay Subhash, that does not mean that in the first trimester also we will require total 350 calories. First trimester 70 to 80 calories, second trimester 230 to 280 calories, and third trimester is 390 to 470 calories. Okay, so make sure you get this. इसके बाद पूछते हैं, they ask you the question like males and females दोनों में कितना आपको चाहिए कैलोरी पर डे. Sedentary worker 2100, just remember 2100 for sedentary worker male and 1600 for sedentary worker female. So male में, you remember male में it is 2100 plus अगर आप इसमें you add 500 or you add 600, so you will get the best answer for moderate and for heavy. Female में remember 1660 है plus you can add 400 and 500. Simple है. So you just add into this female में how much you are going to add. Sorry. So in males it is 2100 plus 600, 700, yeah. And in females it is plus 500 and 600. Okay. So it's super duper easy. You just have to remember this. Okay. Next is second, this is your chart 1. You can take a screenshot right now. Take a screenshot now. This is point number 1 न्यूट्रिशन में, बस ये याद रखना है. दूसरी बात आपको न्यूट्रिशन में याद रखनी है ये चीज़ कि कितना प्रोटीन, कितना फाइबर हमें पॉइंट नंबर 2 चाहिए. प्रोटीन्स हमें 0.83 चाहिए एंड DIASS इज द बेस्ट इंडिकेटर. DIAAS इज द बेस्ट इंडिकेटर for protein quality. For protein quality, DIAAS is the best indicator. What is DIAAS? That is digestible indispensable amino acid score. Next is visible fat intake. Male में 20 to 40, female at 20 to 30. You can just remember this. Dietary fiber has been asked couple of times. It is 40 grams per 2000 kilocal. Carbohydrates कितना चाहिए? Carbs we need is 130 milligrams a day. So make sure you get this. Proteins, whatever I have highlighted, make sure you get this right. These are already available as my flashcard number 1074. It is available in my Instagram channel, and Instagram is a collection of all my flashcards. Okay, so वहाँ से आप सारे flashcard sequence में सारे पढ़ सकते हो. This also has been upgraded there. So this is your flashcard number 2. इसका आप screenshot अभी ले लो. Right. Point number 3. This is about the pregnant female. So how to compare a non-pregnant, pregnant and lactating female? Please remember that in lactation everything is more required more. अगर आप calories देखें, that is required in higher amount compared to the normal calories. If you look at the proteins, it is again slightly more than 9.5 से तो ज़्यादा ही हुआ ना. If you look at the carbohydrates, it is more. If you look at the iodine, it is more. You look at calcium, it is more. You look at vitamin A, it is more. दो चीज़ों में सवाल बनता है. Two things you need to remember, that iron is lesser in lactation and folic acid, common sense, is lesser in lactation. बस दो चीज़ें याद रखो. Folic acid lesser, iron is lesser. These two may form MCQ. This is your flashcard number 3. That's all. न्यूट्रिशन में आपको recommended dietary allowance याद रखने हैं. न्यूट्रिशन में you need to remember about pregnant females, non-pregnant females, what all nutritions you need. So what is more required? Everything is more required except iron and except folate in lactation. Everything is more in lactation except iron and folic acid. बस ये याद रखो. Next is sometimes examiner may try to confuse you or may try to ask you regarding the symptomatology in food poisoning. Of course, this topic is again overlap with microbiology. But for your exam, just remember that the most common food poisoning is a salmonella food poisoning. Salmonellosis is the most common food poisoning. Next is Staph aureus. This is the most fastest food poisoning. Remember, it is the most fastest. It happens within 1 to 8 hours. Botulism, it does not show no diarrhea food poisoning. उल्टा, it may show paralysis हो जाता है patient को. Clostridium perfringens, it has abdominal cramps. It has abdominal cramps and Clostridium is very commonly associated with reheating. Bacillus cereus is with chicken fried rice. जो लोग fried rice या Chinese वाइनीज खाना है, Bacillus cereus, reheating Clostridium, no diarrhea but paralysis वगैरह botulism, fastest Staph aureus, most common is Salmonella. Right? These are very commonly, frequently asked questions. This is your flashcard number 4. इसकी अब एक screenshot ले लो. This may be asked in your exam. Right? And last is this ultra important. This is a 7-star topic. Flashcard number 5 and that's all. Total 5 flashcards दिए मैंने आपको न्यूट्रिशन में. न्यूट्रिशन का चैप्टर 5 flashcards से खत्म हो जाता है. 5 flashcards for nutrition. You talk about the neurolatherism. You should know about aflatoxin, ergots, epidemic, endemic, and neurolatherism, and that's all. Right? 5 flashcards for you guys. 5 flashcards में पूरा न्यूट्रिशन का चैप्टर खत्म होता है. ये 5 flashcards है जिसमें पहले 3 वेरी इंपॉर्टेंट, लास्ट के 2 yes you should do. पहले 3 very important, last के 2 yes you should do. These are flashcards for you. Let's move to the next topic. Burden of disease is given by. Already I have talked to you burden of disease. We have already done this. Burden of disease is given by DALY. Burden of disease is given by DALY. Okay? हमने इसका आंसर करा था. So coming back to the question, which of the following is not correct? Fat intake to be 25 to 40 grams per day. This is true. 420 in third trimester. This is true. Iron in lactation is higher. No, this is false. This is false. Vitamin C is prophylaxis. This is true. Vitamin C is used for prophylaxis. This is true. Let's go back to the next MCQ. Burden of disease is A. Absolutely correct. Let's go to the next MCQ. As a medical officer in ESI, you will ensure a patient in rural area who does not have insurance is treated under. What do you want to say? बस आई थिंक अब हम इमेज बेस्ड क्वेश्चंस करने वाले हैं. As a medical officer in ESI, you will ensure the patient of a rural area who does not have insurance is treated under which benefits? Direct, indirect, sickness या extended sickness? What do you want to say? What do you want to say? Direct medical benefit, indirect sickness या extended sickness? It is indirect benefits. Absolutely correct, beta. This is indirect benefit. This is indirect medical benefit. right? So we can have indirect medical benefits, which are usually for people who does not have complete insurance, or there are empaneled hospitals. You can give indirect insurance. So ESI के अंदर there are a couple of things which may be important for you. ESI, it is under the Ministry of Labor and Employment. It is under the Labor Ministry. Second, the employee will contribute 0.75% and the employer will contribute 3.25% of the wage. टोटल ये लोग 4% वेज देते हैं. ESI के अंदर बेटा, you need to do ESI. You can have medical benefit, that is the sickness benefit, that is for 91 days, 70% of the wage. We can also have extended sickness benefit, that is for 2 years and up till 80% of the wage. The patient may get 80% of the wage. We can also have enhanced medical or the sickness benefit, that is for tubectomy and vasectomy. In case of vasectomy, people will get 7 days of leave, whereas in tubectomy, the female will get 14 days of leave. So these are very important benefits. Plus you also have funeral expense, which is given by the government of India, that is 15,000 rupees of funeral expense for ESI, Employee State Insurance Scheme. It works at a state level. It works at a state level administration. It is under the Ministry of Labor and Employment. So absolutely correct. This is indirect medical benefit. Let's go to the next MCQ. 35-year-old female eats bajra mixed with black seeds. 2 seeds can be segregated with the use of. So what do you want to say? What do you want to see over here? A 35-year-old lady eats bajra mixed with black seeds. 2 seeds can be segregated with this use of. So the answer is absolutely correct. It is 20% sodium water. It's sodium chloride. The 20% salt solution is used. 20% salt solution is to use and to remove the ergot infected seeds. Right? So absolutely correct. This is a plant fungus. Open vial policy is not applicable for. Open vial policy is not applicable for. Open vial policy is not applicable for TPT, TT, hepatitis B or measles. What do you want to say? Open vial policy. It is not applicable for. Absolutely correct answer, beta. It is not applicable for measles. Please remember which vaccine vials the open vial policy does not work. Open vial policy is not applicable on Mera Rota Bichara Jija. Mera Rota Bichara Jija, measles, rubella, rotavirus, BCG, Japanese encephalitis. And you also have COVID-19. And we also have COVID-19. These vaccines do not have open vial policy. Measles, rubella, rotavirus, BCG, Japanese encephalitis and COVID. Mera Rota Bichara Jija, COVID. Yes, absolutely correct. Himani Ray. So yes, आप सबको ये याद है. I'm so happy for you all. Open vial policy is not applicable in measles. It is applicable for all of the following except measles. एक सवाल आता है येलो फीवर वैक्सीन. येलो फीवर वैक्सीन ये किसने बनाई थी? It was by Walter Reed. Walter Reed was the person who invented this yellow fever vaccine. Yellow fever vaccine is also not under open vial policy. It is also not under open vial policy, but of course yellow fever vaccine ही नहीं इंडिया में यूज होती, तो इसलिए इसकी बात नहीं हम करते. But yes, yellow fever vaccine is also not under open vial policy. It should be used within 30 minutes of reconstitution. Within 30 minutes, it should be used, yellow fever vaccine. Yellow fever vaccine 10 days till 10 years तक effect रहता है. So, but usually 10 days till 10 years, but usually we say yellow fever vaccine is given in a lifetime. इसको हम 10 years को it has been taken to lifetime. So initially they were saying like it is applicable from 10 days till 10 years, but now they say that it is applicable for the whole life. So that's what is important. Sir, vaccines का strain याद करना है. I would suggest you to remember the vaccine strains for some of the vaccines. Most important. BCG का कौन सा होता है? BCG. वैक्सीन स्ट्रेन्स. लेट्स रिवाइज वैक्सीन स्ट्रेन्स. ये आ सकता है आपको एग्जाम में. वैक्सीन स्ट्रेन्स फॉर BCG, इट इज डैनिश 1331, येलो फीवर इज 17 डेल्टा स्ट्रेन, चिकन पॉक्स दैट इज OKA वैक्सीन, रुबेला इट इज RA27/3 वैक्सीन, मम्प्स इट इज जेरेल लिन वैक्सीन, Lin vaccine, measles it is Edmonston Zagreb vaccine. बस ये याद रख लो. बाकी कोविड वैक्सीन्स आई वुड ऑल्सो लाइक टू टेल ऑल द स्टूडेंट्स जो अभी लेट ज्वाइन इन किए हैं. आई वुड ऑल्सो लाइक टू टेल ऑल द स्टूडेंट्स जो अभी लेट ज्वाइन इन किए हैं दैट वी हैव ऑलरेडी डिस्कस्ड कोविड वैक्सीन्स. कोविड वैक्सीन शुरू में हमने डिस्कस करी थी. वी डिस्कस्ड ऑल द कोविड टाइप वैक्सीन्स, द कॉर्बेवैक्स, इंकोवैक एंड ज़ाइकोव डी. ये एग्ज़ाम के लिए ज़रूरी हैं. ये पढ़ लेना. कोविड-19 वैक्सीन्स के ऊपर काफ़ी सवाल आते हैं. सो BCG, येलो फीवर, दीज आर द वैक्सीन्स विच आर यूज्ड इन गवर्नमेंट ऑफ इंडिया. ऑफ कोर्स जापानीज एंसेफेलाइटिस, येस, जापानीज एंसेफेलाइटिस वी हैव इज द SA 14-14-2 strain. Japanese encephalitis we have is the SA 14-14-2 strain, and that also can be asked in your exam. Okay, let's come to some of the image based MCQs. Identify the vector. क्या लगता है ये कौन सा जानवर लग रहा है आपको? हाथी, घोड़ा, शेर, चीता, मक्खी, मच्छर, insect, cockroach, seahorse. What do you want to say? What is this? हाथी, घोड़ा, चेर, चीता, सैंडफ्लाई, एनोफ्लिस, क्यूलेक्स, रैटफ्ली. क्या लगता है? क्या बात है, सबने पहचान लिया इस भाई साहब को. दिस इज अ सैंडफ्लाई. एब्सोल्युटली करेक्ट. दिस इज अ सैंडफ्लाई. दिस इज अ सैंडफ्लाई. सैंडफ्लाई हम क्यों बोल रहे हैं? सैंडफ्लाई इसको इसलिए बोल रहे हैं बिकॉज देर आर हेयर. सो याद रखेंगे समथिंग लाइक टू मच हेयरी पर्सन. आई डोंट वांट टू नेम दैट पर्सन, बट याद रख लो कोई बंदा कोई जिसके बहुत सारे बाल हैं उसको भाई साहब को सैंडफ्लाई के नाम से याद कर लो. डायनासोर, ओके, डायनासोर याद कर लो, ठीक है को सर. सो एनीवेज सैंडफ्लाई. अच्छा, हाथी, घोड़ा, शेर, चीता, डायनासोर. ओके. सैंडफ्लाई इज अ हेयरी इंसेक्ट एंड इट हैज लॉट ऑफ हेयर ऑन इट एंड इट हैज वेरी लैंसियोलेट शेप ऑफ विंग्स. लैंसियोलेट शेप ऑफ विंग्स. ये कब काटता है? दिन में काटता है, रात में काटता है, या कब काटता है? रात को 11:15 काटता है. कब काटता है? देवल भाई, ये so lanceolate shape of wings, lanceolate shapes of wings. And when does it bite? It bites us during the daytime or the night time. So बिल्कुल सही बोला, झक्कास आंसर बोला रे. It is night nocturnal biter. It is a nocturnal. रात में 11:15 काटेगा और बहुत जोर से काटेगा. So nocturnal biter, it is a very painful bite. रात में बहुत जोर से काटता है. कौन काटता है? PSM वाला काटता है. सो रिमेंबर, PSM वाला कब काटेगा? रात में काटेगा, बहुत जोर से काटेगा, सैंडफ्लाई लेकर काटेगा. ओके, सो एनीवेज दैट्स व्हाट इज इम्पॉर्टेंट फॉर यू टू रिमेंबर. सैंडफ्लाई एंड इट कॉजेज व्हाट डिजीज बेटा? इट कॉजेज काला आजार. काला आजार को कैसे आप डायग्नोज करते हो? काला आजार इज डायग्नोज्ड यूजिंग RK39. RK39 इज डायग्नोस्टिक टेस्ट फॉर काला आजार. राइट. एक छोटा सा फ्लैश कार्ड है. जस्ट टेक अ वेरी क्विक स्क्रीनशॉट ले लो इसका. ये फ्लैश कार्ड है. पूरे एंटोमोलॉजी आपकी कवर करवा रहा हूँ मैं यहाँ पे, पूरा एंटोमोलॉजी. सो प्लीज़ रिमेंबर कौन सा आपका वो है, कौन सा आपका विच वेक्टर कॉजेज व्हाट डिजीज, विच आर लाउस बॉर्न डिजीज, फ्ली बॉर्न, टिक बॉर्न, what are the different types of fleas that cause disease, rat flea, oriental rat flea, temperate zone, dog, cat fleas, sand fleas क्या क्या cause करते हैं, एंड रिकेट्सिया प्रोवाजाकी, रिकेट्सिया टाइफी, ये एक स्क्रीनशॉट ले लो इसका, इट इज़ अ 7-star MCQ फॉर यू, दिस इज़ अ फ्लैश कार्ड स्क्रीनशॉट फॉर यू, एंड ये एग्जाम में आ सकता है. एंड लेट्स मूव टू द नेक्स्ट वन. आइडेंटिफाई क्या फूड है यहाँ पे, क्या मिल रहा है आपको रात में खाने में, क्या खा रहे हो अभी, कुछ तो खा ही रहे होगे ना तुम लोग भी. एक दफ़ा चैट बॉक्स में डालना तो जरा साथ साथ क्या चल रहा है. सुट्टा चल रहा है, एक पेग चल रहा है, नमकीन चल रहा है, चने, रोस्टेड चने चल रहे हैं. व्हाट आर यू गाइज हैविंग व्हाइल वाचिंग दिस वीडियो. नहीं खा रहे तो कुछ खा लो यार, इतना कहाँ मुझसे सुन रहे हो. मैंने कुछ नहीं खाया, बट आप लोग तो खा ही लो. लिमिटिंग अमाइनो एसिड इन द फूड इज गिवन एज, देख के भूख लगाई है. लिमिटिंग अमाइनो एसिड इन द फूड गिवन इज मेज. शाबाश नीरज मिश्रा, जीता रहे भाई. मेज पहचान लिया दोस्त ने, मेज. सो लिमिटिंग अमाइनो एसिड कौन सा है इसमें, ट्रिप्टोफैन है नीरज, पर ट्रिप्टोफैन तो ऑप्शन में ही नहीं है. अब क्या करेगा भाई मेरा. यू आर सेइंग इट इज ट्रिप्टोफैन, बट ट्रिप्टोफैन तो ऑप्शन में ही नहीं है. अब क्या करना है. ये मिडनाइट में तंग करने आ गए पीएसएम वाले. लिमिटिंग अमाइनो एसिड इन द फूड इज गिवन एज, सो लाइसिन, मिथ्योनिन, सिस्टीन और ल्यूसिन. क्या बोलते हो. लाइसिन इज द करेक्ट आंसर, एब्सोल्युटली करेक्ट, वेरी नाइस. अंकित पांडे बिल्कुल सही बोल रहा. और लाइसिन लिखा तो है नीरज, हाँ लाइसिन भी नहीं है, बिल्कुल ठीक है. ज्योति एब्सोल्युटली करेक्ट, लाइसिन. इफ्रा मलिक, यस इट इज लाइसिन. ल्यूसिन तो एक्सेस होता है इसमें. एमॉक्सिसिलिन, यस मैं वेट कर रहा था इस बात की. थाली याद है, थाली आप लोगों को जिसने क्लासेस में सुना हो, थाली. थ्रियोनिन एंड लाइसिन is deficient in cereals. Pulses are deficient in paracetamol, cysteine and methionine. Trolley for maize. Maize is trolley. That is tryptophan and lysine. Maize is tryptophan and lysine. Remember trolley for maize. Tryptophan, lysine, cysteine, methionine is pulses, threonine and lysine is cereals. Remember thali. So the best answer over here is lysine, is limiting amino acid in the food is given as lysine. Limiting amino acid in the food is given as lysine. Okay, cereals are thali, pulses are paracetamol, maize is trolley. Remember, maize is trolley, pulses paracetamol, cereals is thali. Pulses paracetamol, maize is trolley, and pulses paracetamol, cereals is thali. Which of the following is not correct for a vaccine given below? क्या दिख रहा है यहाँ पे. इमेज देखो इसको, इमेज देखो क्या दिख रहा है आपको. Which of the following is not correct for the vaccine given below? ये रात वाली क्लासेस ना आई वुड से ज़्यादा मज़ेदार होती है. बंदा ना पूरे मूड में पढ़ रहा होता है, पढ़ा रहा होता है. ये रात को सब लोग टेंशन फ्री बैठते हैं. एंड व्हाट यू से, डे टाइम इवनिंग होनी चाहिए क्लासेस या रात में होनी चाहिए. मिडनाइट क्लासेस होनी चाहिए ना. Which of the following is not correct for the vaccine given below? It is given as intradermal injection. First 2 doses are given in the left arm and third in the right arm. It is under open vial policy. The diluent is distilled water. So अगर आपको दिख नहीं रहा, ध्यान से देखो तो ये पोलियोमाइलाइटिस की वायल है. पोलियोमाइलाइटिस का वायल है. सो ये जो पोलियोमाइलाइटिस का वायल है, इट इज़ पोलियोमाइलाइटिस का जो वायल है, this is like having a circle with a square inside. So this has a vaccine vial monitor. ये जो वैक्सीन वाइल मॉनिटर है, इट इज़ ऑन द लेबल. आप देख सकते हो VVM लेबल पे है. सो जिसका VVM बेटा लेबल पे होगा, दैट इज अंडर ओपन वाइल पॉलिसी, and usually it is not हीट सेंसिटिव। वैक्सीन्स जो कि विच आर हीट सेंसिटिव, द वैक्सीन्स, ध्यान से सुनना, द वैक्सीन्स विच आर हीट सेंसिटिव। सो हीट सेंसिटिव वैक्सीन्स का जो वैक्सीन वाइल मॉनिटर है वो या तो इसके नेक के ऊपर होगा, यहां पे होगा, या फिर ऑन द कैप होगा। बट द वैक्सीन्स विच आर नॉट हीट सेंसिटिव, उनका द VVM इज लोकेटेड ऑन द लेबल। Okay, that's an important difference, right? So the vaccine while monitor is on the label, so it shows that it is not a very heat sensitive. It is given as intradermal injection. This is true, yes, because it is fractional IPV. The first two doses are given in the left arm. The first two doses are given in the left arm and the third is given in the right arm. This is also true. It is under open vial policy. It is under open vial policy. This is also true. You can open it and you can keep it for the next 28 days. This is also true. The diluent is distilled water. This is the wrong one. This is false option. Absolutely correct. It is answer number D, delta. That is the false option and that is the correct one. Let us move to the next MCQ. Which waste is disposed in the following symbol category? कौन सा लगता है आपको following symbol category में कौन सा waste लग रहा है? Chemical waste black category, cytotoxic waste red category, chemical waste yellow category, cytotoxic waste yellow category. What do you want to say? Which waste is disposed of in the following symbol category? So what do you want to say? It is a cytotoxic waste, absolutely correct. C stands for a cytotoxic waste. And the cytotoxic waste is discarded in which category, beta? It is discarded in the yellow category. It is discarded in the yellow category. Yellow. So it is discarded in the yellow category. Cytotoxic waste is discarded in the yellow category. Cytotoxic waste is discarded in yellow category. Okay. Let us move to some of the more symbols. अब इन symbols पे मैंने बजाय कि I made questions directly. Can you recognize this symbol? Option number A, B, C, D, E, F. So, okay. Which one is A? A is for what? What do you think? A is for what? What do you think? Option A, beta. A किसके लिए? Option number 1, like the first image, this image is for what? Any idea? Ayushman Bharat, absolutely correct. This is for Ayushman Bharat scheme. It is PMJ. What is PMJ? PMJ stands for the Pradhan Mantri Jan Arogya Yojana. Absolutely correct. All those students who are answering it correct. Absolutely correct. Option number B, second one. So सारे लिखते जाओ कौन कौन से लगते हैं आपको. सेकंड का क्या है, थर्ड का क्या है, फोर्थ, फिफ्थ, सिक्स्थ, सबका क्या है. So what do you think about option B? Option B क्या लगता है आपको? बेटा option B is for civil registration system. Option B is for CRS, Civil Registration System. एक जोत जग रही है, that is birth. And then there is a black thing which ends, that is death. So birth and death, that is Civil Registration System. Option C, like what is this image number C? Image C is for what? E is NLEP, absolutely correct. C किसके लिए है? C is IDSP, beta. What is IDSP? IDSP is Integrated Disease Surveillance Program. So absolutely correct. Very nice. IDSP is Integrated Disease Surveillance Program. इसमें कितनी दफ़ा सर्वेलेंस करते हैं? These are weekly surveillance. Weekly होता है और इसमें 3 levels होते हैं. You have S, P and L. What is S, P and L? What is S? S stands for syndromic surveillance. P stands for probable surveillance. L stands for laboratory surveillance. हो जाएगा याद. S, P and L. IDSP की मैं बात कर रहा हूँ. S, P and L syndromic, probable and L is laboratory surveillance. D किसके लिए होता है? D stands for पोषण scheme. D is पोषण scheme. D stands for पोषण scheme. D is पोषण, absolutely nice, very correct. नीरज मिश्रा, बिल्कुल ठीक बोले आप. D is for पोषण. E is NLEP, National Leprosy Eradication Program. F is for National Program for Control of Blindness and Visual Impairment. The full name is NPCBVI. NPCBVI, National Program for Control of Blindness and Visual Impairment. पोषण के ऊपर एक सवाल आ सकता है, ये हमने बहुत पहले भी डिस्कस किया था. पोषण स्कीम, पोषण के ऊपर क्वेश्चन आ सकता है. पोषण स्कीम, प्लीज नोट दैट देयर आर 2 पोषण. दिस इज अ फ्लैश कार्ड फॉर यू. सो इस फ्लैश कार्ड का भी आप पिचिक करके स्क्रीनशॉट ले लो. सो स्क्रीनशॉट कैसे लेना है वो आप लोग जानते होंगे, बट स्क्रीनशॉट में क्या इंपॉर्टेंट है वो मैं लिखने वाला हूँ. ये जो पोषण स्कीम है, ये जो पोषण स्कीम है, इट इज़ पोषण प्रधानमंत्री पोषण शक्ति निर्माण स्कीम. प्लीज रिमेंबर दिस इज अंडर द मिनिस्ट्री ऑफ एजुकेशन. It is under the Ministry of Education. Poshan scheme is under the Ministry of Education. Then there is a Poshan Abhiyan. Poshan Abhiyan is under the Ministry of Health and Family Welfare. Poshan Abhiyan is under the Ministry of Health and Family Welfare. बहुत बड़ा अंतर है. The Poshan scheme, it is a new name. It is a new name for the midday meal scheme or the midday meal program. Whereas Poshan Abhiyan, it is the National Nutrition Mission. National Nutritional Mission. Poshan Abhiyan. It was started on 8th of March 2018. Poshan scheme was started in year 2021. पोषण स्कीम के तहत वी आर गिविंग 450 कैलोरीज टू अपर प्राइमरी टू प्राइमरी क्लास एंड 700 कैलोरीज टू अपर प्राइमरी क्लास एंड इट इज़ फॉर ऑल चिल्ड्रन फ्रॉम क्लास 1 टिल क्लास 8. ये सारे MCQs बनते हैं. दिस इज़ अ 7-star MCQ फ्लैश कार्ड स्लाइड फॉर यू. इट इज़ अ 7-star MCQ फ्लैश कार्ड स्लाइड फॉर यू. ये पढ़ लेना ध्यान से. पोषण शक्ति निर्माण स्कीम, पोषण शक्ति निर्माण स्कीम. सो प्लीज मेक श्योर दैट यू स्टडी दिस. Poshan Abhiyan, National Nutrition Mission is under the Ministry of Health and Family Welfare. Poshan Abhiyan is to reduce anemia. Please remember, it is to reduce anemia by 3% and to reduce low birth weight by 2% in the community. Anemia को 3% reduction, low birth weight को 2% reduction is Poshan Abhiyan. Poshan scheme is midday meals को program. So please remember, ये 2 दफ़ा आपको पढ़ना पड़ेगा. Please take a screenshot for this and it is ultra important for your exam. It is a probable MCQ. ये जो पोषण, ये जो आर्क टाइप है, ये वाला इमेज, ये किसका है? इज इट फॉर पोषण अभियान और फॉर पोषण मिशन? प्लीज नोट दिस इज फॉर पोषण अभियान. व्हाट इज पोषण अभियान? प्राइम मिनिस्टर ओवरआर्किंग स्कीम फॉर होलिस्टिक नरिशमेंट. प्रधानमंत्री ओवरआर्किंग स्कीम फॉर होलिस्टिक नरिशमेंट. लेट्स मूव टू द नेक्स्ट पेज. Like what are the use of these? What are these logos for? 1, 2, 3, 4, 5, 6 and 7. फटाफट से बोलो, what are these logos for? What are these logos for? So what is 1, 2, 3, 4, 5, 6, 7? 1 will stand for, 1 means that is for, absolutely correct. It is National Health Mission. Very nice, very nice. National Health Mission, बिल्कुल ठीक है. 1 is for National Health Mission. 2 is for a new logo for the NTEP. NTEP के I would also like to tell all the students who have joined in late. All the students who have joined in late, I would like to tell you that initially we have already discussed lot of questions about the NTEP updates. प्लीज़ रिमेंबर, हमने NTEP के कुछ अपडेट्स बात किए हैं 2022 में, वो एक दफ़ा देख लेना आप वीडियो में पीछे जाके. दीज आर द नेशनल TB एलिमिनेशन प्रोग्राम अपडेट्स फॉर यू. सो अपडेट्स में सबसे पहली चीज़ तो है कि ये लोगो भी अपडेट हो गया है. दिस इज द न्यू लोगो. Then third number is for which disease, like what program? Third number is for Anemia Mukt Bharat. You can see 6 people, 1, 2, 3, 4, 5 and 6 people. So it is a 6 by 6 by 6 beneficiaries. याद रखना 6 interventions, 6 beneficiaries and 6 इसमें आपके institutional mechanisms. So please remember, this is Anemia Mukt Bharat. Anemia Mukt Bharat is again a very important program. इसमें you need to remember the iron folic acid supplements to different age group. इसका टेबल बना हुआ है, it is available everywhere. इसका फ्लैश कार्ड भी है. So please remember, अनीमिया मुक्त भारत को पढ़ के ज़रूर जाना. Then is this new logo for number 4. What is number 4? Absolutely correct. Ifra Malik. You have correctly pointed out. This is the National Family Planning. It has one child. It is a new logo. It is for the National Family Planning Program. 5 number. 5 is for किसने बोला? Ifra Malik. Absolutely correct. You got this one, beta. This is ESI program. This is ESI program. Employee State Insurance Employee State Insurance Scheme, or the Employee State Insurance Corporation, ESI Corporation. So ESI, we have already discussed. ESI was launched as ESI Act in 1948. The ESI Day is on 24th of February. ESI Day is on 24th of February. Okay, ESI Day is on 24th of February every year. Option number 6, 6 number, ICDS, Superstar Krishna Kumar. Absolutely correct. Perfect answer, ICDS. What is the full form of ICDS, beta? ICDS, Integrated Child Development Dash. Integrated Child Development Dash. What do you want to say? ICDS. Option 7 क्या है? Option 7 is NIDDCP. That is National Iodine Deficiency Disorder Control Program. National Iodine Deficiency Disorder Control Program. So child pick inside mother. ICDS. S stands for scheme. Wrong answer, Amritansh. S does not stand for scheme. No, it is not scheme, Akhil Khan. It is not scheme. Superstar Krishna Kumar. It stands for Integrated Child Development Services, which is the correct answer. It stands for Integrated Child Development Services, which is the correct answer. Ifra Malik, बिल्कुल ठीक बोले आप बेटा. Very nice. It is Integrated Child Development Services. It is not scheme. Yes, it is Integrated Child Development Services scheme. Very nice. So this is IDDSP and NIDDCP, National Iodine Deficiency Disorder Control Program. NIDDCP के ऊपर 2-3 सवाल बनते हैं. नेशनल आयोडीन डेफिशिएंसी डिसऑर्डर कंट्रोल प्रोग्राम, इसमें जो सॉल्ट होता है, इट शुड हैव आयोडीन, इट शुड बी आयोडाइज सॉल्ट. आयोडाइजेशन शुड बी मोर देन 15 पार्ट पर मिलियन at consumer level, and it should be more than 30 parts per million at production level. NIDDCP में they also ask you about the indicators. The long term indicator is goiter rate, but which is the principal impact indicator? Which is the principal impact indicator? The principal impact indicator is the urinary iodine excretion rate. Principal impact indicator is the urinary iodine excretion rate, which is the indicator for environmental iodine deficiency. Indicator for the environmental iodine deficiency. Indicator for the environmental iodine deficiency, that is a neonatal hypothyroidism rates. ये बहुत दफ़ा पूछते हैं, इसको याद रख लो. एक लास्ट सवाल लिख लो. What is the process indicator? Which is the process indicator? Process indicator is iodine in household salt. Iodine in household salt is the process indicator. Absolutely correct. That is NIDDCP. Coming over to the next one, like what are the images you see over here? What is this? 1.35. What do you want to say? ये तो आपके फेवरेट आंसर होने चाहिए. फटाफट से चिपकाओ आंसर अपने चैट बॉक्स में. आई एम वेटिंग फॉर योर आंसर्स. मैं तब तक थोड़ा सा वेरी नाइस, गुड वंस. सो बिल्कुल ठीक कह रहे हो. 1.35 इज व्हाट? सपना और मीना बोलो फटाफट से. 1.35, Meena with a parrot. Meena goes with a parrot. Meena goes with a parrot. Meena is parrot. Meena goes with the parrot. Remember, Meena goes with the parrot. Sapna goes to school. Sapna goes to school. Sapna goes to school. Remember, Sapna school jayegi. Meena parrot. Meena parrot, Sapna school. Meena parrot, Sapna school. They both are the mascot for leprosy program. Meena parrot, Sapna school. They both go for the leprosy program. Then 1.38. Anybody who remembers 1.38, जिन लोगों ने क्लास अटेंड की आपको याद होगा. 1.38. 1.38. What does this mean? 1.38. What is this program for? What is this logo for? All those who have attended classes, you should remember this. 1.38 is for what? That is for mental health program. Very nice. It is for the mental health program. It is for the mental health program. And 3.1 is the vaccine while monitor. Vaccine while monitor. VVM is for the vaccine while monitor. Can you tell me when do we do the discard? When is the discard point? Absolutely correct, beta. It is Neeraj for Neeraj Mishra. Absolutely correct. It is for mental health. Very nice, superstar. So, vaccine while monitor. Can you tell me which one is the discard point? The discard point is A, B, C, D, E. कब discard करेंगे? Discard कब करना है इसको? The discard point is option D, when it is same color. When it is same color, at that point we are going to discard this vials. So coming to the next ones, you have 1, 2, 3, 4 and 5. Bolo fatafat se. What is option number 1? 1. Do you see a head? Yes or no? 1 is what? 2 is what? 3 is what? 4 is what? 5 is what? What do you think? What do you think? So 1 is what? 1 is absolutely correct. 1 is a hard tick or a soft tick. क्या बोलना चाहते हो? 1 is no head. 2, you see a head. Head is present. Because the head is present, this tick is called as a hard tick. Remember, if you see a head, it is a hard tick, and if there is no head, this is a soft tick. This is a soft tick. Can you see the number of pairs of legs? They both have 4 pairs of legs. They both have 4 pairs of legs. All the ticks will have 4 pairs of legs. Option number 3. Option number 3 is Sarcoptes scabies. Sarcoptes scabies. Sarcoptes scabies, that is the itch mite. इसको कैसे याद रखना है? How will you remember this itch mite? So if you just look at this itch mite, I'll just zoom into this. If you look at this itch mite, it will always have these thick type of anterior legs. It will have thick anterior legs. Can you see this? It will have thick anterior legs, and these are what are the suckers. These are what are the suckers. They attach to the skin. They are within the skin. ये जो उंगलियां है ना, उंगलियों के बीच में ये जो itch mite है, ये उंगलियों के बीच में होता है, एंड ये वहाँ पे बरोज बना के इट अटैचेस टू द स्किन, एंड यहाँ पे ये स्केबीज कॉज करता है, एंड दैट इज़ द रीज़न बहुत ज़्यादा खुजली होगी. देयर इज़ इंटेंस इचिंग स्पेशली ड्यूरिंग द नाइट टाइम. नाइट टाइम में इच क्यों ज़्यादा होती है? बिकॉज द वेसल्स डायलेट, एंड ये जो एक्टिविटी है इच माइट का, इट इंक्रीजेज ड्यूरिंग द नाइट टाइम. सो रात में कौन लोग जागते हैं? या तो सैंड फ्लाई काटेगा या फिर इच माइट काटेगा, याद रख लो, या पीएसएम वाला काटेगा. रात में कौन लोग काटेंगे? इच माइट काटेगा, खुजली करेगा बहुत ज़्यादा, या सैंड फ्लाई काटेगा, या पीएसएम वाला काटेगा. दीज आर व्हाट आर इंपॉर्टेंट पॉइंट्स फॉर यू टू रिमेंबर फॉर योर एग्जाम, एंड आई होप ये आप याद रखेंगे. ओके, नेक्स्ट इज पॉइंट नंबर 4. पॉइंट नंबर 4 में क्या है? पॉइंट नंबर 4 इज व्हाट इज अ लाउज. पॉइंट नंबर 4 इज व्हाट इज अ लाउज. लाउज याद करो, L फॉर एल से क्या होता है? एल से लंबा होता है, लंबा मतलब लाउज होता है। और कुछ गलत मत सोचो बेटा, एल मतलब लॉन्ग होता है। एल इज लॉन्ग, एल इज लॉन्ग, एल इज लाउज, और एल इज लॉन्ग, एल इज लाउज, एंड जस्ट रिमेंबर इट हैज़ क्लॉज। इसके पास पंजे होते हैं, ऐसे पकड़ लेता है। इट हैज़ क्लॉज। तुम गलत सोचते हो, बहुत बेकार बंदे हो तुम लोग। सो एल फॉर लाउज, एल फॉर लॉन्ग, एल से पंजे होते हैं, इट हैज़ क्लॉज, इट ऑल्सो हैज़ क्लॉज। मैं कह रहा हूँ गलत मत सोचो, तुम और गलत सोचते हो। एल फॉर लाउज, एल फॉर लॉन्ग, एल फॉर क्लॉज। ओके, सो याद रखो, लंबा लाउज, लाउज लंबा। नेक्स्ट इज ऑप्शन नंबर 5। ऑप्शन नंबर 5 इज, अब क्या करें, तुम लोग रात को पढ़वा रहे हो तो ऐसे ही बोलना होगा। तुम लोग रात को भी पढ़ते हो, मेरे से भी पढ़वाते हो या ब्रॉड माइंडेड मेडिकोस। अब क्या करेंगे? एल फॉर लाउज, एल फॉर लंबा। नेक्स्ट इज 5। 5 नंबर इज व्हाट? 5 नंबर इज व्हाट इज? rat flea. 5 number is what is? Rat flea, rat flea, rat flea. Rat flea, please remember, rat flea के ऊपर there are no wings. Rat flea के ऊपर there will not be any wings. Rat flea will not have any wings. There are no wings in rat fleas. Okay? There are no wings in a rat flea. And rat flea will cause what disease? Rat flea will cause plague. प्लेग के ऊपर एक और सवाल आता है। प्लेग के ऊपर एक दो और सवाल आते हैं बेटा। प्लेग जो है, प्लेग जो है, प्लेग इज कॉज्ड बाय अ ब्लॉक्ड फ्ली, ब्लॉक्ड फ्ली, एंड प्लेग is transmitted as 3 different types. We can have septicemic plague, pneumonic plague, bubonic plague. The septicemic and pneumonic plague, in दोनों का incubation period is 1 to 3 days only, whereas for bubonic plague it is for 2 to 7 days. Pneumonic plague is the most rapid spread, most rapidly spread होता है, transmit होता है. It can be transmitted by droplets or aerosols. Bubonic is usually fluid or body secretion transmitted, body secretions से transmit होगा, and that also from the buboes. So buboes are involved. They are not. They only have indirect mode of transmission, and buboes are there in lymph nodes. Lymph nodes में. Please remember P for plague. Plague में कौन सा transmission होता है? Plague has a propagated mode of transmission. Remember cyclopropagative किस में होता है? Remember cyclopropagative. Cyclopropagative mode of transmission. We can have a cyclo-developmental mode of transmission, or we can have a propagative mode of transmission. Propagative तो अभी आपने बात किया प्लेग में होता है ना? Cyclo-developmental mode of transmission किस में होता है? Cyclo-developmental is where there is development. It is microfilaria. Microfilaria. Cyclopropagative क्या होता है? Once there is development with propagation. So there is change in number plus size. That is cyclopropagative. ये कहाँ पे होता है? ये मलेरिया में होता है बेटा. इसको याद रखो, ये मलेरिया में होता है एनोफ्लीज मॉस्किटो के साथ. ये क्यूलेक्स के अंदर माइक्रोफाइलेरिया के साथ. देयर इज चेंज इन शेप only, and change in number only is what is propagative, that is found in plague. ये याद रखना, ये भी important होता है, काफ़ी दफ़ा एग्जाम में पूछा गया है. Okay, so let's move to the next slide. What is this? What is 3.10 and what is 3.11? What is 3.6? 3.6 is what is a vasectomy holder. It is a vas holder. It is a vas holder. ये यूज़ कहाँ करते हैं? जब वैसेक्टमी करते हैं तब ये काम आता है. इससे पकड़ के वास डेफरेंस को पकड़ना होता है. 3.10 is what is a Horrocks apparatus. Horrocks apparatus क्या बताता है बेटा? Horrocks apparatus will tell you, yes, this is number 2. This is number 1. This is 3. This is 4. Okay. So Horrocks apparatus क्या बताता है? It tells us about the chlorine demand. it tells us about the chlorine demand. हॉरक्स सेपरेटस के ऊपर एक दो और सवाल आते हैं. हॉरक्स सेपरेटस जो है, it tells you about what? It tells us about the chlorine demand of the water. क्लोरीन कितना होना चाहिए पानी में? It should be more than 0.5 parts per million. What is the main action of chlorination? Main action of chlorination is the hypochlorous ions. Hypochlorous ions is the main action of chlorination. It should always be more than 0.5 parts per million. अगर outbreak होगा तो there you have to ensure more than 0.7 parts per million of the chlorine level, but generally speaking chlorine should be more than 0.5 parts per million, and main action is with the hypochlorous ions. Please remember, how do we check for chlorination? You check for chlorination using orthotolidine test. Orthotolidine test ये बताएगा about the free and combined chlorine levels. अगर आप इनको सेपरेटली चेक करना चाहते हो, इफ यू वांट टू चेक देम सेपरेटली वी डू ऑर्थोटोलिडीन आर्सेनेट test. We do orthotolidine arsenate test, which will tell us about the free and the combined chlorine separately. So free and combined chlorine combined कौन बताएगा? Orthotolidine test. Orthotolidine test is arsenate test. Right? That is orthotolidine arsenate test. Coming to 3.11, what is this 3.11 beta? 3.11 is for which, this device or instrument is used in which disease? That is used for tuberculosis. It is a gene expert. That is for tuberculosis, gene expert. Gene expert, tuberculosis. Right? And last is point number 4. What is this? This is a Harpenden caliper. Harpenden's caliper. Please remember, obesity के जितने भी criterias हैं वो सब आपको पढ़ के जाने हैं. What are the obesity criterias? What is the criteria for waist hip ratios? What is the criteria for skin fold thickness? What is the criteria for obesity parameters? These are very important, frequently asked for your exams. इनका भी flashcards I will give it to you somewhere after the class. PDF में डाल के या कुछ करते हैं. But obesity indicators are very frequently asked in your exam. Obesity indicators are again very frequently asked in your exam. Please make sure skin fold thickness. These all you have to do. So I'll just try to tell you or show you probably. I'll send you the PDF, and in that you can see about the skin fold thickness also. Right? So that is Harpenden's caliper. That is for skin fold thickness. Coming to the next one. Last one. This is the last point. कि ये क्या है? I know this is a growth chart. This is the last point. This is the last slide I have. This is growth chart. Growth chart में बेटा, you have to note that this point is what is the normal zone. And till this point, it is minus 2 SD. This corresponds to minus 3 SD. So this point, the upper point, it is at the 50th percentage. It is the median. It is at the 50th percentage or the median. Okay, then you have from the normal till minus 2, that is the green zone, minus 2, minus 3. Yellow zone below minus 3 hota hai, red zone. So this is what is mild, moderate malnutrition. Mild to moderate malnutrition, and below this zone, this is what is severe malnutrition. Severe malnutrition. Okay, so above वाला जो पॉइंट है ये नॉर्मल होता है, ये मीडियन जोन पे होता है. एक दो पॉइंट और अबाउट मैल न्यूट्रिशन. प्लीज रिमेंबर, मैल न्यूट्रिशन में वेट फॉर एज, वेट फॉर हाइट, हाइट फॉर एज, वेरी फ्रीक्वेंटली आस्क्ड एमसीक्यू है. Weight for age is a general marker for undernutrition. Weight for height, that is for acute malnutrition, and height for age is for chronic malnutrition. Okay, ये जो weight for height है, weight for height, it is marker for acute. weight for age जो हम use करते हैं, that is used in growth charts. अगर weight for height low है, it is called as wasting, and if there is height for age low, it is called as stunting. When will you refer, next MCQ, question number 1 ये था. Point number 2, when will you refer the patient for nutritional rehab center? When will you refer to NRC? We will refer the patient to the NRC if the child is SAM. What is a SAM? Severe acute malnutrition. If the child is having severe acute malnutrition, we will refer the child to a SAM, to the NRC. When do you say SAM child? When do you say SAM child? SAM is severe acute malnutrition if the weight for height is less than -3 SD. If the mid upper arm circumference is less than 11.5, and if the child is having bilateral pedal edema. So in cases में we are going to send the child to the, in case of bilateral pedal edema, in these cases we are going to send the child to the nutritional rehab centers. फिर सवाल आपसे पूछ सकते हैं, ये यहाँ तक तो it is all 7-star MCQ. It is all 7-star MCQ. This they can ask you, NRC में क्या करते हैं? NRC is Nutritional Rehabilitation Center. Nutritional Rehabilitation Center. NRC में बेटा we are going to give the starter diet, which is also known as F75 diet. इसके बाद हम देते हैं कैच अप डाइट. कैच अप डाइट is also known as F100 diet. In the initial phase, that is the stabilization phase, this is the stabilization phase. In the initial phase, stabilization phase, we are going to give the starter diet also called as F75 diet. Then you have the transition phase. Then you have the transition phase. In the transition phase, इसको थोड़ा सा zoom out कर देते हैं, like you can see it probably. In the transition phase, you can see that in the transition phase, we are going to give the catch-up diet, and this catch-up diet is also called as F100 diet. So please remember, these are few points that can be asked to you from the NRC topic, and ये growth charts को ज़रूर याद रखें. So that was all from my side. Any doubts you have, anything you want to ask? Any doubts or anything you want to ask? I know it's very late now. It's past midnight. And I would like to thank you all for giving consistently best answers. And you all had been amazing bunch of students जो काफ़ी questions में आप answer भी कर रहे थे. So any doubts you have, I'm open to any doubts you have. कुछ पूछना चाहते हो? Oh, thank you so much विवेक कुमार. Excellent efforts from all your student side, because इतनी देर रात तक आप बैठे हो, पढ़ाई कर रहे हो. So बहुत अच्छा लगता है that you all are putting in lot of efforts. That's what is actually important also ना. बाकी तो सब इधर के मोह माया ही है ना. तो that's more important that you all are able to contribute towards learning more. So बेटा देव, इनिशियली आई डोंट नो इफ़ यू वर देयर. इनिशियली मैंने आपके सबके साथ ना एक ये कोहॉर्ट स्टडीज़ का मैंने एक चार्ट प्रेजेंट किया था आपको. सो आई डिस्कस दिस पॉइंट अबाउट द एपिडेमियोलॉजिकल स्टडी डिज़ाइंस. सो चार्ट में से ही क्वेश्चन आएगा, इसका स्क्रीनशॉट ले लो. इसके अलावा दुनिया ख़त्म है, बस यही याद रख लो. यही है जो कुछ है. ओके अजीज़ मोहम्मद, आपका बहुत बहुत धन्यवाद. थैंक यू सो मच फॉर ज्वाइनिंग. एंड व्हाट इज़ जीवन बिंदी सर? जीवन बिंदी, इट्स अ स्मॉल स्टेट बेस्ड प्रोग्राम बेटा. इट्स नॉट रिक्वायर्ड फॉर, इट्स अ स्टेट लेवल प्रोग्राम. ये यूज़ होता है फॉर लाइक फैमिली प्लानिंग, एंड इट्स अ इनिशिएटिव विच वाज स्टार्टेड इन उत्तर प्रदेश. and that's what is like इट वॉज स्टार्टेड इन उत्तर प्रदेश, वो फीमेल के लिए ना फैमिली टू इम्प्रूव maternal like mortalities because of anemia. So that is what is जीवन बिंदी, that is for anemia के लिए यूज होता है ये प्रोग्राम. सो इन्होंने क्या किया था, जीवन बिंदी जिसमें आयोडीन और आयरन का मिक्सचर होता है, दैट वो यहाँ से ना स्किन से एब्जॉर्ब होता है. इट्स नॉट रिक्वायर्ड एट योर लेवल. Sir, please explain what is attributable risk factor. Attributable risk factor is like, let us say एक patient को in case some patient gets some cancer, तो उसको कैंसर होगा. There may be some smokers and there may be some non-smokers. स्मोकिंग ग्रुप में कितने लोगों को कैंसर हुआ और नॉन स्मोकर्स में भी तो कैंसर हो सकता है. So how many people get cancer within the smoker group? This funda is called as attributable risk. Attributable risk क्या बताता है बेटा? Attributable risk, it is given by the formula incidence exposed minus incidence non-exposed divided by incidence exposed. It tells us the amount of disease among the exposed population. It is the amount of disease among the exposed population, that is what is attributable risk. Fly high, thank you so much for joining in. Next question, RDT malaria kit after testing will be put into red or the yellow category. So Samina Behra, very nice question. RDT kits, these come under the laboratory biotechnology waste and they are put under the yellow H category. So therefore your answer should be yellow category. Madhav Sharma, sir, now it's time to use Ujala scheme. Yes, Ujala, light, LED. So, thank you so much, Dev and Amritansh Iodine. Yes, that Bindi, it's basically for family planning, it's for mother program and even क्या होता है? Even is electronic vaccine intelligence network. Next doubt जो पूछा है, very nice doubt. Even क्या होता है? Even is electronic vaccine intelligence network. बेसिकली क्या होता है, बिकॉज वैक्सीन इज अ कमोडिटी जो कि सब जगह यूज होना है, राइट. सो कुछ स्टेट ऑफ बिहार में आप बैठे हैं तो बिहार में कितना वैक्सीन पड़ा है, गुजरात में कितना पड़ा है, मध्य प्रदेश में कितना पड़ा है, ये यू शुड बी नोइंग. सो इट्स काइंड ऑफ ए सॉफ्टवेयर दैट वी यूज, इवन सॉफ्टवेयर. इसमें यू हैव टू पुट इन एवरी डे एवरी वीक, जब भी इम्यूनाइजेशन सेशन होता है यू अपडेट दिस इवन सॉफ्टवेयर सो दैट द सेंट्रल बंदा जो बैठा है हु लुक्स एट द सॉफ्टवेयर, they come to know that Gujarat mein acha this many are remaining, this many had been supplied, this many are used. It tells you about the logistic availability of the vaccines. It tells us about the logistic availability of vaccines. Okay, it tells us about the logistic availability of the vaccine. So Rizwan, thank you so much. PSM Simplified is what my main motto is, and that's what I always feel from my heart, that PSM or community medicine should be simplified. I have a study from edition 5. Is it enough? Yes, beta, it is very much enough. बस edition 6 के कुछ programs हैं, NLEP है, TB है, ये update हुए हैं, ज़्यादा कुछ नहीं है. Edition 5, if you have studied, all the very best. That's okay. क्वांटिटी क्वालिटेटिव पैरामीट्रिक टेस्ट, ये इसका ना एक टेबल है अमृतांश. आई हैव ऑलरेडी मेड द टेबल. ऑफ कोर्स it's already available in all my flashcard series. If you just look at the Telegram group mein I have shared a lot of material. So all this material is available. See, there are 3 sources in case you are preparing for exam. I would say first source is what is my website, PSM Simplified. So there is this website psmsimplified.com. इसमें जाओ, इसमें अपडेट सेक्शन में जाओ and you will find many PDFs over there. So अमृतांश आलूवालिया specially for you, वहाँ पे एक PDF पड़ा हुआ है on this website that is about the statistics, biostat simplified. So that's a small PDF where I have summarized the whole biostats in I think fewer than 5-6 pages ka hai. Okay, so if you just visit this website, I don't know if I'm PSM Simplified.com. I don't know if this is... So beta, what I have done is I have gone to this update section. So in this update section, in this website, I have just opened this website psmsimplified.com, if you can just see. So in this psmsimplified.com, I will go and have a look at there is a PDF about the revision class notes are available. MTP Act is available. Then I had made a PSM updates and biostat, summary of the biostat. This is for you, Amritansh. So that is what I was talking, and you wanted to know about the parametric. You just open this and you download this file. You'll be able to access almost everything about the quantitative qualitative test. So one is this resource you should be using. The second resource that you can take is the Telegram group. So I have made a Telegram group. In this group, beta, everyone is allowed to speak. You put your questions, you see your answers, and this group has been active since the last couple of years. And there are more than 16,000 students who are participating in the group. And we conduct quizzes, and I give answers almost every day as much as I can. And your Telegram group is fairly active. I personally give answers to every question that is there. So Telegram group pe, even if you have a doubt, at least you can search on a Telegram group, right? So that Telegram group is by the name of Mukhmohit, Community Medicine discussion. So just join this group. You will get a lot of PDFs, lot of the information is already available if you just search your doubt over there. The third is your Insta. So my Insta, not your Insta. From your Insta, you come to my Insta page. And on the Instagram page, I have, that is by name of Dr. Mukhmohit. And on the Instagram page, you can just see all the flashcards. All flashcards are available. So I put this Insta is basically because Insta did not let me write. I started putting in the picture format, and in the picture format, I found that students actually had that visual memory. So the flashcards are available at the Instagram page. Telegram is for all the PDFs and documents. And of course, if you want to learn more, it's always there on the YouTube. So YouTube also has a lot of my playlist is there. All the lectures are there. All the MCQ recalls that we do, it's already available on the YouTube. These are the 4 major things. And right now, your exam is on your head. Don't increase your syllabus. Just try to revise from these 3 topics only, right? So, well, that was for you, Amritansh. That was a big answer to you. Ifra Malik, thank you so much for joining in, bache. Vashishta Patidhar, drug resistant TB. Beta, drug resistant TB. DRTB. It can be H monodrug resistance. It can be multi-drug resistance. It can be XDR, extensively drug resistance. It can be total drug resistance. The H mono means only isoniazid resistance. This is the most common type of drug resistance. MDR means H and R, both multi-drug resistance, both H and R. If there is any other drug resistance, any other drug except H and R, it is called as a polydrug resistance. It is called as a polydrug resistance TB. XDR could be a pre-XDR or XDR. Pre-XDR is fluoroquinolones plus pre-XDR is what is H and R plus any group A drugs. H and R plus any fluoroquinolone. XDR is H and R plus any fluoroquinolone plus any group A drugs. So that is XDR. And TDR is many drugs, total drug resistance. XDR is extensively drug resistance TB. So you have these types of drug resistance TB in tuberculosis, and tuberculosis definitely has a very high amount of drug resistance. So there are two diseases which we are tackling for drug resistance in India. One is tuberculosis and another is typhoid. Typhoid also has a huge amount of drug resistance. Typhoid, I would like to show you a flashcard. Typhoid has a very high amount of drug resistance, and therefore typhoid is becoming a public health problem in India. And there is a new vaccine which has been started, that is a typhoid conjugate vaccine. So this vaccine can be asked in your exam. You already knew that there is a Typhi, oral Typhi, and a VI polysaccharide. But there is now a new typhoid conjugate vaccine beta, which has been included into the public health system across the globe, and it has been given approval by the WHO also. It is a new vaccine. So anyways, your question was regarding TB, and I have given you the system for drug resistant TB. So currently same packs are used for PBA for 6 months. No Subiksha beta. I have already discussed in the initial part of the lecture. Probably you came and joined in late. I discussed all the controversies. I'm telling all the students who have joined in late again that we discussed these 5 major controversies about the perinatal, rabies, NLEP. That is what your question is again. BMW and ASHA population norms. So remember, I have already talked about these topics. Initially, and the system has already been discussed regarding that. Okay, so well, with that, I'd like to thank you so much for joining in. Any doubt, any alpha error or beta error में क्या difference है? Sir, Telegram group name. Telegram group name is, I'll share with you my Telegram group name. This is beta. I'm sharing with you the Telegram group name. Where did that go? I think the computer is also hanging now. So in the start, I had discussed all these controversies, bache, and we had already covered these controversies. On NEET PG के लिए, yes, I will be coming up with the new sessions for NEET PG. We will do this for NEET PG separately. NEET PG is upcoming. Don't worry, I will be doing one session for NEET PG also. So thank you so much. Will we get PDF? इतना जोर लगाया शिल्पा आनंद. Yes, we will try to send you PDFs. Don't worry. I will share this PDF. This PDF will be shared in the Telegram group. Okay. This PDF will be available in the Telegram group. And so, beta, these are the 3 sources that I am telling you again. And इन्हीं में से ही you need to take everything. And I think that's all for the session today. I would like to thank you for joining in the session today, and I hope this session worked as a magic for you, and I sincerely pray to God that everybody should be clearing exam. I know it's very late in night and you all want to take rest, but ठीक है, चलता है. Sometimes it happens, and I pray to God that everybody should clear this exam with the best possible scores and the scores which you actually deserve, and you may clear this exam with the sense of satisfaction and fulfillment. That's very important, right? So मेरी पूरी आपसे मतलब कोशिश है कि आप लोग अपने एग्ज़ाम में अच्छी तरह पास हो और अपना कॉन्फिडेंस पूरा बरकरार रखो, right? So please remember that it's important for you to right now study for exam and clear the exam. Your parents are waiting for you to become doctors and practice in India, right? चलो और मोटिवेशन नहीं चलेगी, अभी बहुत रात हो गई है, अभी रेस्ट करो and make sure you revise everything. All the very best बेटा. Join the Telegram group का लिंक मैंने इसमें शेयर कर दिया है. I would suggest you to join the Telegram group and also look at the Instagram page. So Instagram पे बहुत सारे आपको फ्लैश कार्ड्स मिलेंगे and Telegram group में you will get a lot of PDFs, of course, and the YouTube is there. All the very best and thank you so much. Namaskar and good night.